conference, let me at the outset wish you a very happy Unani Day. Actually, this is a momentous occasion for all of you to take part in this international conference. So without waste of time, I would invite Dr. Pradeep Multani as the first speaker. He looks very dynamic. I have met him and I've grown taking Kuka syrup in my childhood. So you must have all heard about Multani pharmacy, and this name obviously comes from Multan. So I welcome Dr. Pradeep Multani, and we should be very much strictly following the time allotted, and so that every speaker gets equal time. Thank you.
Thank you very much. I presume, sir, 5 minutes, 10 minutes. 5 से 10 बोला था. 10 minutes, great. Good morning to our family of Ayush and Unani systems. A very happy Unani Day to all. Today's topic is quality Unani products for healthcare systems. The role of industry is most important. Before I come to the topic, I would like to just share with you what is the status of the Ayush sector and Unani sector today in the world. World over, there is recognition of the strength of the Ayush system of medicine. Also, Government of India is strongly promoting and supporting the Ayush sector in every way possible. Everyone in the Ayush sector, all of us need to rise to the occasion and grab this golden opportunity. If we remember COVID period, India with 140 crore population had the least number of deaths compared to the population ratio, percentage की बात कर रहा हूँ. And also our recovery rates were very fast. If we have to provide universal healthcare in India, अगर हम सिर्फ allopathic system पे रहेंगे, because वो system तो वहाँ पे, I have my own brother who's a cardiologist in LA, USA, and also my sister's husband is orthopedic surgeon there. There were bodies lying in the morgues. It was a hopeless state, and definitely our government, our Ayurvedic doctors, Unani doctors, I think they did a fantastic job. हमारी जैसे औषधियाँ थी, like Ayush Joshanda, Khamira Marwarid, Sharbat Unab, ये सब, they were outstanding as immunity boosters. And like I said, they definitely played a major role in low death rates and early recovery. I would also like to just share with you what is the Government of India doing for this. I'm quoting an extract from what the Honorable Prime Minister said. Our Honorable Prime Minister, Mr. Modi, has recently highlighted the new opportunities in the field of Ayush and Unani. These include farming of medicinal herbs, manufacturing and sale of products, great scope for Ayush and Unani startups. About 40,000 MSMEs are active in the Ayush sector. The Ayush industry, which was about rupees 20,000 crore 8 years ago, has reached about rupees 1.5 lakh crore today. This means there has been a growth of 7 times in 7-8 years. This is what our Prime Minister stated. Today, Ayush sector has been given recognition by more than 30 countries as traditional system of medicines. Now I come to today's topic, quality Unani products for healthcare systems. The role of industry is most important. Understandably, the burden of upholding the manufacturing of quality of products, because industry manufactures, lies completely on us. Hence, we should comply with all the necessary rules and regulations which have been laid down by our various governments, our Ministry of Ayush, and ensure that we are implementing to the full. We all know for quality standards and manufacture of Unani medicines, the Unani Pharmacopoeia of India and National Formulary of Unani Medicine are the regulatory compendia. We must implement them fully. These pharmacopoeia ensure drug quality, safety, and efficacy. All the production units, as per our Drug and Cosmetic Acts, must have WHO GMP certification, and all whatever we need to follow is listed there. Now, it is very, very important that they have mentioned that we should be doing testing and all in our own laboratories. So we must have all the relevant laboratory equipments so that we can ensure good quality of our products. Dr. Manoj Johri gave a good detailed lecture. I strongly feel having NABL accredited laboratory is a must. I will just say, we all went through that period. अभी जब हमने अखबार में पढ़ा कि भाई गैम्बिया में और उज़्बेकिस्तान में 300 लोगों की allegedly 300 children died because of consumption of cup syrups. ये तो गरीमत है कि वो जाके आयुष यूनानी के प्रोडक्ट्स नहीं थे, नहीं तो पूरे पेपर से ब्लास्ट हो रहा होता कि जी देखो जी आयुर्वेदिक या यूनानी प्रोडक्ट से ये हो गया. तो हमारे सबके लिए बहुत ही अनिवार्य है that we must have in-house drug testing laboratory, if possible food testing laboratories, क्योंकि अब आयुष आहार भी आ गया है, and they must be approved. I would strongly recommend by Ministry of Ayush, of course, and I would say CDSCO plus NABL accreditation is very, very important. Along with, we also had from Quality Council of India, when he mentioned about Ayush Premium Mark, Ayush Standard Mark, again, I think it is very, very important to have those sort of marks, because how do we ensure that the customer has confidence on our products? There are many, the facts and figures were already laid out, so I will not repeat them, but I think we must work on in that direction. जितनी जल्दी हम आयुष अपनी companies को आयुष standard mark and we take आयुष premium mark, the happier we will be. Of course, ISO standards must be also met with. Then in today's date, if we have to talk, what does the world want today? They want clinical trials. They want that, जो हम पहले कहते थे जी 5000 साल हमारी सिस्टम पुराना है, टाइम टेस्टेड है. Yes, that is a fact, because if it was not efficacious system, Unani or Ayush were not efficacious system, तो वैसे ही खत्म हो जाते. Yes, they are efficacious, but we have to talk the language as per modern times. Hence, it is very, very important for us to do R&D, कि जो हमारे ग्रंथों में लिखा हुआ है, उसको how can we further, do research on them, develop on them, and from them also pick up more efficacious products to meet the present demand of our population. We also had the session on quality medicinal plants. अगर वो जड़ी बूटी और raw material ही हमारा ठीक नहीं होगा, so how can we get quality products? And it is very important that we must have, like I mentioned, NAB, Ministry of Ayush, CDSCO, NABL accredited drug testing laboratory in our premises. Otherwise, it's not possible. I again talk about रात को नींद नहीं आती जब वो होता है कि भैया क्योंकि हमारा कूका कफ सिरप एक ब्रांड लीडर है कफ सिरप में, वो जा एंड वी आर एक्सपोर्टिंग टू न्यूमरस कंट्रीज, तो जब वो आता है जी कफ सिरप से इतने लोग मर गए, तो वैसे ही रात को नींद खराब. सो अकॉर्डिंग टू मी, अगेन आई रिपीट, वेरी वेरी इंपॉर्टेंट, अगर हमारे अपने प्लांट में NABL accredited, मिनिस्ट्री ऑफ आयुष, CDSC अप्रूव्ड ड्रग्स टेस्टिंग लेबॉर्ट्री नहीं है तो प्रॉब्लम होगी. और उसी में जैसे मैं आपको कह दूं कि हुआ क्या था, व्हाट हैपेंड विद दोस कप सिरप्स. पहली बात है, इट इज़ एन एलिगेशन, वेदर इट इज़ प्रूवन और नॉट वी डोंट नो, बट एक चीज़ बहुत अनिवार्य है कि ये तो पता चले हुआ क्या था. हुआ ये था, जो मेरे को बताया गया है, कि उसमें जाके उठा के पड़ता है पॉलीप्रोपिलीन ग्लाइकॉल, उसके बदले में जो सस्ता होता है एथिलीन ग्लाइकॉल से एडल्ट्रेशन हो गया था. और हमें ये भी पता है कि इन लोगों ने जो अच्छी कंपनी हैं, एक जाके मनाली ड्रग्स करके है जो सप्लाई करता है और एक गुलशन पॉलीमर्स करके करता है, दे आर बोथ गुड ब्रांड्स. द सप्लायर हु गेव इट टू देम मस्ट हैव हैड एडल्ट्रेटेड, डुप्लीकेट, काउंटरफीट प्रोडक्ट्स जो उन्होंने उनको सप्लाई कर दिए, और इन्होंने अपने यूज़ करने से पहले टेस्ट नहीं करे. ये मैं कंफर्म बोल रहा हूँ कि मैंने उनसे पता करा था. तो इस टाइप की चीज़ों को हम कैसे अवॉइड करेंगे, तो इसलिए जो मैंने यहाँ सेशन हुआ था NABL का, वो बहुत ज़रूरी है. अब लेट मी, क्योंकि आज में मेरे को ये भी बोला हुआ है कि भैया भूतानी फार्म्स लिमिटेड का अपना एक्सपीरियंस क्या है, वो भी शेयर करिए. देखिए, हमारी कंपनी 1938 में लाहौर अनडिवाइडेड इंडिया में स्थापित हुई थी. मेरे दादाजी पंडित ठाकुर दत्त मुल्तानी जी ने करी थी, उसका मेरे पिताजी थे, अब मैं हूँ, मेरे 2 बेटे भी हैं. और उन्होंने हमको सिर्फ ये समझाते थे कि याद रखिएगा, यू आर मेकिंग मेडिसिन्स, यू आर नॉट मेकिंग क्लोथ्स, पैंट्स और शर्ट्स. तो औषधि हो टॉप क्वालिटी की औषधि हो और उसमें पूरी गुणवत्ता हो और सबसे आपको आशीर्वाद और दुआएं मिलें। तो ये हमारे परिवार का एक सिस्टम चल रहा है सिंस 1938। अब इस साल हम 84 साल 84 ईयर्स यंग हुए हैं। तो हमारी कंपनी जो है, हमारी कंपनी हम करते क्या हैं, हमने जाके अपनी कंपनी में एक तो 200 से ज़्यादा आयुष प्रीमियम मार्क लिए हुए हैं, आयुर्वेदिक और यूनानी दोनों प्रोडक्ट्स के लिए। और हमारे दिल्ली और उत्तराखंड प्लांट हैं, दोनों में हमारे पास आयुष स्टैंडर्ड मार्क है। हमारे पास रिसर्च एंड डेवलपमेंट मुल्तानी कंपनी का है, जो DSI डिपार्टमेंट ऑफ साइंटिफिक इंडस्ट्रियल रिसर्च वहाँ से अप्रूव्ड है। इसके अलावा हमारे पास हमने लगभग 10 करोड़ लगाया है मुल्तानी ड्रग टेस्टिंग लेबॉर्ट्री पे, और साथ में 10 करोड़ ये अब लगाया है फूड टेस्टिंग लेबॉर्ट्री पर। ड्रग टेस्टिंग का तो पहले ही हमारे पास मिनिस्ट्री ऑफ आयुष अपना CDSCO एंड एनेबल एक्रेडिटेड है, और अभी प्रोसेस चल रहा है फॉर एनेबल एक्रेडिटेशन फॉर अ फूड टेस्टिंग लेबॉर्ट्री ऑल्सो। अब आता है जो हम बात कर रहे थे कि भाई रॉ मटेरियल बढ़िया होना चाहिए, उसके लिए हमने मेडिसिनल की प्लांट कल्टीवेशन में भी चले गए। आज के युग में जब हमारे प्रधानमंत्री जी कहते हैं कि भाई फार्मर्स इनकम डबल करो, वो डबल वीट राइस से तो होगी नहीं, ये तो वो तब होगी जब ये लोग हमारे किसान भाई मेडिसिनल प्लांट कल्टीवेशन पे शिफ्ट करें, और वो अगर शिफ्ट करते हैं तो वी विल गेट गुड क्वालिटी प्रोडक्ट्स और उनकी भी आमदनी डबल हो जाएगी। सो वी हैव मुल्तानी हैज़ गॉट इनटू मेडिसिनल प्लांट कल्टीवेशन। हम हरिद्वार में कर रहे हैं, और पहले हम चाहते हैं पहले खुद सीख लें, देन वी वांट टू गेट इनटू बिग टाइम इनटू कॉन्ट्रैक्ट फार्मिंग विद अदर फार्मर्स ऑल्सो, उनके साथ मिलकर। क्योंकि पीछे हमने अश्वगंधा जब कोविड हुआ था तो हमने कईयों के साथ कॉन्ट्रैक्ट मैन्युफैक्चरिंग टाइप करा था। तो जब रेट होता है तब तो उन्होंने हमको देने को तैयार थे, जब रेट बढ़ गया तो सब बैकआउट कर गए। तो जरा हम समझ जाएं, ताकि भैया हम भला चाहना चाहते हैं, हमारा नुकसान ना हो जाए। सो दिस इज जस्ट व्हाट आई वांट टू शेयर विद यू, कि ये जरूर कहना चाहूँगा कि इस जो स्वर्ण घड़ी को हम कोई चूके ना, क्योंकि हम समझ चुके हैं कि, फिर मैं रिपीट कर रहा हूँ कि भैया विदाउट द ट्रेडिशनल सिस्टम ऑफ मेडिसिन और आयुष और यूनानी, पूरी भारत की पॉपुलेशन को बढ़िया हेल्थ केयर मिल ही नहीं सकता। और ये भी जरूर होता है, कई बार हमको टेंशन होती है कि भैया ये चीज़ें बड़ी बड़ी ऊंची ऊंची बातें करी, हमारे छोटे भाई भी हैं। लेकिन मैं सिर्फ ये कहना चाहूँगा कि जब हमारे पास when we have absolutely outstanding officials who are always very supportive to us, हमारे साथ डॉक्टर खालिद बैठे हुए हैं, डॉक्टर रमन सिंह बैठे हैं, कासमी साहब, आसिम अली खान साहब, आप जिसका नाम लीजिए, देर ऑल देयर टू। मनीष पांडे जी हैं हमारे, जौहरी जी चले गए, देर ऑल, ये तो भैया दे हैंड होल्ड अस। हम जब व्हेन आई वाज द प्रेसिडेंट ऑफ PhD चैम्बर, वो कहते, सरकार कहती थी आप बताइए कैसे बनाएं, हम कहते थे हमें काम करने दो, और जो हमारे ब्यूरोक्रेट्स होते हैं दे शुड बी मोटिवेटर वो मोटिवेट करें इंडस्ट्री को, हमारे को गाइड करें, और जो लक्ष्य हमारा है कि दुनिया की थर्ड बिगेस्ट इकॉनमी को बनने का, वो भैया ये हम सिर्फ सरकार का नहीं, हम सबका है। और हम ब्लेस्ड हैं कि वी गॉट वंडरफुल ऑफिशियल्स हु गाइड अस, हेल्प अस। सो आई विल जस्ट से कि भैया देर इज़, और कई बार ये भी सोचते हैं हम लोग बड़ी कंपटीशन है, अरे कंपटीशन क्या है, देर इज़ इनफ सनशाइन फॉर ईच एंड एवरी वन फॉर अस। लोग अगर कहते हैं हमारी 140 करोड़ की आबादी है, लुक एट द कस्टमर बेस, और दुनिया भर हमारा कस्टमर है। सो उसकी हमें चिंता नहीं करनी चाहिए, हम सबको एज अ परिवार मिलकर पूरी कोशिश करनी चाहिए कि हम अपने आयुष सिस्टम को और यूनानी सिस्टम को आगे लेके चलें। थैंक यू एंड मे अल्लाह ब्लेस अस ऑल।
Thank you, Dr. Deep. Very importantly, you have pointed out that there is a huge market and huge beneficiaries all over the world. Only last night I had a friend who is a very senior surgeon at Chicago, and he has seen that Muleti and Joshanda, they were very effective in American people for post-COVID cough. And he was talking of patenting this combination, because combination they never tried. So they are trying different methods in America, what to. And he has grown his hair within 6 months with ginseng. So their benefits are infinite. And now one message I want to give to all those who are associated with Ayush, Raman Singh Saab, we should be a team with allopathic doctors. Ayush and allopatha, I will call it allopatha. Ayurveda and allopatha should combine together in one. I was very sad when the separate building was allotted to Ayush Ministry other than Nirvan Bhavan, but in any way it is a growth. So we should work together because most of our patients are very happy when we talk about Ayurveda or Unani with them. And they are really very happy, and our Prime Minister wants to propagate this message that promote Ayush, promote Unani, promote Ayurveda. So I hand over the mic to Khalid Saab and Raman Saab and my colleague so that they can conduct the other deliberations.
First of all, I congratulate all of you on this occasion of Unani Day. And अभी जो सर ने बोला कि इस विषय में आपको मैं थोड़ा सा बता दूं सर कि ऑलरेडी हम लोग इस दिशा में काम कर रहे हैं और ब्रेन स्टॉर्मिंग सेशंस भी चल रहे हैं। जैसा कि हमारे यहाँ कई बार होम्योपैथिक कॉलेजेस के बच्चे लगातार आते हैं ट्रेनिंग के नाम विजिट करने के लिए, ट्रेनिंग पर्पस के लिए, तो हम उनको केवल होम्योपैथी का लेबोरेटरी ही नहीं घुमाते हैं बल्कि उनको पूरा अपना आयुष का जो हमारे तीनों डिपार्टमेंट है, यूनानी, सिद्धा और आयुर्वेदिक, सारी लेबोरेटरीज में पूरे बिल्डिंग्स में उनको विजिट कराते हैं, उनको सारी मेथड्स उनको सिखाते हैं और लास्ट में उनको ये बताते हैं कि आपको पहला सुख निरोगी काया, इस दिशा में आप काम कर रहे हैं जो हमारे शास्त्रों ने कहा है और एक अच्छा कदम है जिसमें आप लोग नए बच्चे जो सब फर्स्ट ईयर के ज़्यादातर बच्चे होते हैं BHMs के, तो उनको आकर के फिर बोलना पड़ता है, बताना पड़ता है कि आपको इंटीग्रेटेड करना है सिस्टम को। ये नहीं कि आप केवल होम्योपैथी का ही यूज़ कर रहे हैं, ठीक है आप उसकी पढ़ाई करिए, मगर जब आपके पास मरीज आता है कोई तो आपका पर्पस ये होता है कि वो बिल्कुल वहाँ से संतुष्ट होकर जाए, ठीक होकर जाए। पहले जैसे लोग डॉक्टर्स देखते थे, नाड़ी पकड़ के देखा, आँख देखा, या फिर उससे बातचीत करिए कि उन्होंने क्या उनकी दिनचर्या है, क्या उन्होंने खाया पिया है। अगर आप इतना भी कर दिया तो साइकोलॉजिकली आपने 50% ट्रीटमेंट तो वैसे हो जाता है जब डॉक्टर बात करता है मरीज से, और आप केवल लिखते चले गए और कहा कि वहाँ से मेडिसिन ले लीजिए तो उसको लगता है कि डॉक्टर ने मुझे ठीक से देखा ही नहीं। तो ऐसी बहुत सारी चीज़ें कि आपको साइकोलॉजिकल ट्रीटमेंट भी देना है। एलोपैथी जहाँ यूज़ हो रही है एलोपैथी को यूज़ करिए, एलोपैथी वाले आपके सिस्टम को यूज़ करते हैं, वो भी लिव 52 लिखते हैं। तो ऐसा नहीं है कि किसी एक को अपनाना है, आपका पर्पस है कि मरीज को ठीक करके जाना। तो इंटीग्रेटेड सिस्टम, और गवर्नमेंट भी इस दिशा में सर सोच रही है। आपने देखा ही होगा कि हर हॉस्पिटल्स में और मेडिकल कॉलेजेस में आज की डेट में सब आयुष डिस्पेंसरी हो रही है सब जगह। तो मैं सोचता हूँ आने वाले समय में ये काफ़ी तरक्की होगी इस क्षेत्र में भी। और जैसा मुल्तानी साहब बोल रहे थे कि उस दिशा में सर देखिए क्वालिटी मेंटेन तब होगी किसी भी सिस्टम की, चाहे वो एलोपैथी हो या हमारा ट्रेडिशनल सिस्टम हो, जब तक उसकी स्टैंडर्ड मजबूती होंगे। सो वी शुड have our standard at par with any other international standard or more than that, because we are ahead of in this Ayush. तो आने वाले समय में हमारा यही पर्पस है कि हम अपने चारों फार्माकोपिया को मजबूत करें। और अभी जो हमें गवर्नमेंट ने वन नेशन वन हार्ट और वन स्टैंडर्ड के तहत एक जिम्मेवारी दी है कि एक ही हम आने वाले समय में फार्माकोपिया पब्लिश करेंगे जो कि टेक केयर एक ही प्लांट से, क्योंकि ओरिजिन से आयुर्वेद में भी यूज़ होता है, वो होम्योपैथी में भी यूज़ होता है, यूनानी में भी यूज़ होता है। तो एक फार्माकोपिया में आपको सारे स्टैंडर्ड्स दिखाई देंगे। इवन सोवा रिपा को भी हमने उसमें ऐड कर लिया है। तो टाइम विल कम और काफ़ी सारे ब्रेनस्टॉर्मिंग सेशन सिर्फ मैंने 3 महीने पहले ही ज्वाइन किया है और 3-4 महीने में कम से कम भी 10 प्रोग्राम अटेंड किए हैं। एक PhD चैम्बर ऑफ कॉमर्स में डॉक्टर जोशी भी थे वहाँ पर ऑलरेडी इस बात पे चल रहा है कि भाई अगर अल्टरनेट मेडिसिन को कैसे लिया जाए, क्योंकि अगर रॉ मटेरियल आपको सही नहीं मिलेगा तो मेडिसिन बनाने वाली कंपनी क्या करेगी और मरीजों के ऊपर असर खास होगा जब तक आपको रॉ मटेरियल सही नहीं मिलेगा। तो एवरीथिंग इज गोइंग ऑन सर एंड इन कमिंग डेज इट विल बी हैपन टू। थैंक यू सर।
Thank you, Dr. Raman Singh. Without wasting time, I'll invite Dr. Santosh Joshi to share his experiences from Amrit Laboratories. Friends, as today is being Friday, most of us will be living for Friday files. So I would request the speaker to stick to the timelines. so that the session may be winded up as early as possible.
Yeah, thank you. Thank you for giving us this opportunity. Can I have my presentation? Hamdard Laboratories. Yeah, good afternoon to all of you and warm wishes on Unani Day. Today we are here just because of the great personality that is Hakim Ajmal Khan Sahab. All members who are practicing Unani system of medicine, whether they are teachers, students or manufacturing industry, researchers, all are here to share their activities and whatever achievements they did in last 1 year. As the leading manufacturer of Unani medicine, Hamdard is always dedicated for Unani system of medicine to take it to new heights. Next slide, please. So our journey in Unani system of medicine starts with sourcing of the raw material. As Pradeep Multani ji has also told, that sourcing of raw material, good quality of raw material is a big challenge. And then after different steps of quality processing, we are ending up with safe and efficacious herbal medicines. And each step of the processing, we are adding value. And how we are adding value, that I will describe in my next slide. Next slide. Sourcing of the raw material is mostly done from the wild source because raw materials cultivation is done only to a limited extent at present, and getting the raw material from vendors is always a challenging task for herbal industries, and the raw material collection time, harvesting procedures and storage, everything remains undocumented. There is no clue from where the raw material was collected, at what time it has been collected, and all these factors are very important, as all of you know that. So the responsibility of herbal drug manufacturers become very much important to judge the right quality of raw material for manufacturing of drug, so that the efficacious drug must reach to the patient. And Hamdard has established very advanced lab to make it sure that whatever raw material is going for manufacturing of herbal medicines, Unani medicines, are of good quality. And also we have initiated cultivation. Around 80 acres of land we have acquired, where we are cultivating medicinal plants, especially those medicinal plants where we are facing challenges of adulteration and intermixing, and also where we are not getting optimum level of active ingredients. Some of the medicinal plants are I have included in this slide: Bhumi Amla, Brahmi, Rose. These all are using we are using in huge amount, and we have started cultivation. And in coming years, we are also looking forward for collaborative projects, collaborative farming. Second slide. Next slide. Before this. So the most important thing after sourcing of the right quality of raw material is the extraction. Whether we are efficiently extracting out the active ingredient, whether we are able to retain the thermolabile compounds, where we are restoring the volatile components of the plant material. These are very important parameters, so that we can ensure the biological actives present in the drug is up to the optimum level. Last year we have introduced an extraction facility at our Ghaziabad plant, where we have invested more than 25 crores, where we are having very efficient extraction provision. Suppose we are extracting tulsi or rehan. Okay, thank you. If we are extracting rehan, during extraction by conventional method, we are losing all the volatile components with steam. Now, in our new facility, when we are extracting it, we are ensuring that whatever volatile component of a plant material is getting collected as a distillate, and finally it has been added to the final product, so that all the essential active part of the extract remains, and thus we are ensuring that the final product where we are using all these extracts are having more efficacy. This you can experience that the same formulations manufactured by different manufacturer looks different, having different aroma, having different efficacy, and it depends only on the procedures what we are following during extraction process. While manufacturing, we have to adopt all the good practices what manufacturer of a pharmaceutical product is adopting. It is not like that we are manufacturing herbal medicine, then it can be done in a normal way in an open area. So we have created WHO GMP compliant facility at Okhla, where we have invested around 200 crore rupees for creating a WHO GMP compliance of facility where everything has been made as per CGMP practices. We are having HBSE systems in our facility. We have man and material movement separate, means so that there should not be cross-contamination of the raw material. And we are having robust documentation system in our facility so that we can comply with international regulations. Apart from our Okhla plant, in our Ghaziabad facility also we have modernized our plant, where we have invested around 50 crores of rupees to meet the international guidelines, and thorough automation has been adopted while manufacturing of Unani drugs. We are maintaining in-process quality, and we are having advanced research lab where we are doing all research for analysis of active ingredients in the raw material and as far as possible in the finished product also. We are having regulatory compliances like GMP, ISO standard, ISO premium, ISO certification, halal certification, and one of our facility has been inspected by US FDA, and we have successfully complied to the US FDA regulations. Now we are looking forward for US FDA certification for our two facilities, that is at Ghaziabad and at Okhla. Also, as we have constructed our facility as per WHO GMP compliance, soon we will be applying for WHO GMP compliance certification. R&D is the backbone of any country, any industry. If we are having robust R&D system, only then we will survive in coming time in the competition of globalization. We are seeing number of companies like Himalaya or Dabur. They are successfully manufacturing their product and marketing their product, and their product can be visible internationally. Wherever we are going, whether it is Middle East or Southeast Asian countries or regulated market, we can see their products. Like that, we also have to ensure that whatever product we are manufacturing under Unani license must reach to the global level. And I personally feel that there is ample opportunity, because Unani has a wide acceptance, because it has traveled through Middle East only and it came to India and it got enriched. So Hamdard is planning to take these medicines to different countries. Last year we had a visit to different countries, which I will show you in next slide. And we are also conducting research on different dosage form, because some of the dosage form where we are using sugar as a base, like sharbats, khamiras, and some other formulations, we can't give those formulations to diabetic patients. Right now we are conducting research on that, how we can provide an alternate format of the dosage form so that each patient can get benefit from the Unani system. We are having ample opportunity to take our medicines for lifestyle diseases, chronic diseases, and for that also Hamdard is doing a lot of research work, and soon number of formulations in that area will be licensed and will be given to the required patients. Generation of safety and efficacy data. Yeah.
Please try to conclude.
Yeah. So we are also conducting this clinical trials, because as Multani ji has told, in modern world, in regulated market, people just ask for the regulatory compliances, and clinical trial data is one of the most important thing. In our research and development lab, we are conducting very strict quality control for manufacturing of the products which are going for clinical trial data. And during COVID time, we have conducted clinical trial on 2 of our formulations, that is Infuja and Kuljum. And for these formulations, we have found very good efficacy against COVID-19 prophylaxis. This data was published in Phytotherapy Research, a journal of repute. And for this, we have created all the data like stability study, and we have created self-life study. And the study has been done by third-party lab so that unbiased data was generated. This is the biosafety level 2 facility which we have created in our medical college at Himsar. All HPTLC and GCMS and all profile has been done for the product at Vimta lab. And we have also initiated these wellness centers across the India. Now, currently we are having 9 wellness centers across the India, and we are also having plan to establish wellness centers where people can visit and take advantage of Unani system of medicine in other countries also. For taking this system to different part of the world, we have visited Kazakhstan, Kyrgyzstan, Indonesia recently on 26th of January on invite of Consul General of India in Medan in Indonesia. We have visited there, and we have seen a lot of people showing interest on traditional Unani system of medicines, and they were just asking from where we can get these medicines. So we are planning to enter in international business while maintaining the regulations, because we have to follow the country specific regulations when we are exporting our product. And we have received international award for our contributions. Sheikh Zayed International Award we have received last year for maintaining CGMP, and Atal Award was received by our chairman Mr. Abdul Majid Sahab in last December for his excellent contribution towards Unani system of medicine. Hamdard is an active member of PSD Chamber of Commerce of India, where Pradeep Multani ji was last president, and he has supported us a lot to put forth our challenges what we are facing in Unani industry. Hamdard is an active member of AMAM. We are also active member of PSD, FICCI, and also founding member of the Ayush Export Promotion Council. I will show you one short corporate video. Can you run this?
Hamdard Clinic, founded in 1906 on a vision to serve mankind and propagate Unani in India. Today, Hamdard India is a market leader in Unani. India has seen a steep upward trend in the practice of a healthier and holistic lifestyle. And people have started emphasizing mindful habits along with consuming natural products due to the ever-increasing awareness of one's overall well-being and immunity. Most modern societies have primarily approached health from a curative lens, seeking help only when symptoms visibly impede our functioning, as opposed to putting in consistent effort to ensure our well-being. Our efforts in Hamdard through R&D has always been to create products that are timeless in treating ailments from the root and providing holistic solutions. Purity, quality, excellence have been the pillars on which we've built ourselves. We have worked tirelessly for the past 116 years to keep the legacy of Hamdard alive and have been recognized for our efforts. Evidence-based medicines, state-of-art laboratories, team of qualified technicians, researchers, clinical research backed by science and nature, hand-grown herbs, quality ingredients, team of experts, and a loyal band of consumers have helped us achieve our milestones. Our Today is about delivering excellence across our business sectors and across the globe. Our Today is dedicated to better the communities we serve with quality products manufactured in our state-of-art factories, and we follow good manufacturing practices to make us who we are.
Thank you. We extend on behalf of Hamdard Laboratories India our thanks to CCREM, entire team, DG CCREM for inviting us and giving us this opportunity, and a special thanks to Ministry of Ayush for supporting us. And this time we are getting all kind of support, and we have to show that we are dedicated for taking this system of medicine to international level, and there is all reason to take this system to international level, because we are having best medicines, we are having best formulations and best scientists available over here, and we are confident that in coming years we will reach new heights. Thank you.
Dr. Santosh Joshi. May I now invite Dr. Nabil Anwar from Red Laboratories, Meerut, to share his experiences.
Good afternoon and Assalamu alaikum to respected dignitaries on the dais and off the dais. Coming from the Nabil. Yeah. So coming from the pharma background, I will share just a few slides which are concerned. Basically, the quality as shared. Next slide. Can you change the slide, please? As told by one of our teachers when we were studying, the quality is a journey, not a destination. Quality is a journey, not a destination. So it has to be, quality has to be taken care of at every step, and it's not a final thing that we have to look for. So quality depends on raw material, processes, what we are following, testing and packaging, and also the storage conditions. So all these things we have to follow if we are giving a good quality product. So when we see in the market, we see the final product that is there, but we don't see the roots, that is the processes that has been taken care of. And the important thing that from our perspective is the main thing is the raw material. If the raw material quality is good, then everything, the final processes will be good. However, best our testing laboratory or testing things are there. If raw material quality is not good, then our product will lack the quality. So what is the difference between pharmaceuticals and Ayush? Because I have worked in pharmaceuticals, so I know there is a huge difference. If we see a paracetamol tablet is not 500 mg. 500 mg ka agar tablet hai, if it is not 500 mg, it's a substandard. But in our system, we don't look at the ingredients which are present. We look at the pH, we look at the weight, we look at microbial contents, and we look at the aflatoxins are checked. but the ingredients which are mentioned on the labels, that are the most important thing that we have to check for. So what I am suggesting, or from the industry point, I am suggesting we should look for ingredients that are there, and there should be certified raw materials. Like in IP, Indian Pharmacopoeia, we can have certified raw materials from Unani Pharmacopoeia of India or Ayurvedic Pharmacopoeia of India. So industries can buy those pharmacopoeia, because not every industry has a scientist and R&D lab which is NABL or Ayush Premium certified. So if in the market, ministry can collaborate with farmers, they can set standards for the raw material, it will be very good. And also if we can have proper guidelines for extract, because many companies have started using extract, but there is no proper guideline ke how much we have to use in place of exact raw material. So those both things can have a good effect on quality. Also processes should be system driven and not person driven, because when we have seen in some companies one person leave, the quality changes. So it should not be like this. The quality should be processes different, proper SOPs should be laid down, and checks at every point from raw material to testing and secondary packaging should be done. For unique products, in vitro studies minimum should be done, and market classical products which have been used and tested for generations can be introduced with different brand names. We as a drugs laboratories are doing in vitro studies and we are publishing it. Recently we have done Sugreen 120 trial and it has been published in Pharmaco magazine, and now we have also sent for MDPI Switzerland magazine this trial. So if these trials are being published, then allopathic doctors will also get confidence that this product is having a good quality. Also, looking from the government tenders, the government should not be looking only at the L1 or the lowest rates. Check the quality of the product should be also be done, because what is happening every year, the raw material cost is increasing, and every year people are quoting lower rates. So at the end of the day, there is being some compromises maybe doing. So the quality of the product should be the most important, because at the end of the day, those are also being consumed by the human beings. Post-COVID, entire world is looking at India for quality product, with Indian companies like Multani ji has shared linked cough syrups linked to children death. Quality is of utmost concern in India and abroad also. So if we use the products made in our factories in our home, then we can be confident of our product. That was a saying that in our family also, because we have been associated for Unani for more than 2 centuries. So हमारे घर में हमेशा ये कहते थे, अगर कोई फैक्ट्री में या क्लिनिक में दवा बनती है तो वो घर में यूज़ होनी चाहिए, तो वो घर पे ही हमेशा यूज़ होती है. और मैं ख्याल से याद नहीं कि हम लोगों ने कभी एंटीबायोटिक्स या कुछ और पेन किलर्स हमेशा खाए हों. तो दैट क्वालिटी शुड बी देयर इन ऑल आवर प्रोडक्ट. And if we can have this journey, if we can have this milestones at every point, the journey which I said, the quality is a journey, we can have that journey a memorable one. Thank you.
Can we break the session after this, or we can have one speaker?
One last speaker.
Okay, please.
May I invite Mr. Mohsin Delhi from Delhi Laboratories to express his experiences.
Assalamu alaikum and good afternoon everyone. Congratulations on Unani Day. Quality Unani products. Since morning in this hall we've been hearing about quality, quality, quality. The success of any healthcare industry depends on 3 important parameters. Main is quality, then comes the safety, and then the efficacy of a product. TQM, that's Total Quality Management. Due to globalization and increased competition, prime focus of every company, whether it's an allopathic company or an Ayurvedic or Unani, is to maintain quality, which is an important factor and controls the other factors known as safety and efficacy, which in turn produces zero defect products. We at Delvi Remedies Private Limited adopt quality management techniques that have overridden the traditional management styles but retaining the traditional values. We have carefully implemented quality management practices to stay ahead of competition. TQM is the most important aspect of our management process because without TQM, we would not have existed for so many years. Our company is, if we see the family tradition, it is 95 years old. Like Nabil before me said, that if one does not use his own products manufactured by him, then there's no point in being in this industry. Because main focus is on our health, and if we cannot give our children the products that we manufacture, then that is a different proposition and we should not be in this system at all. TQM is very important in today's scenario because of the high demand of quality products from customers. If a company wants to stay in business selling their products to customers, they must implement TQM in their business practice, sorry, or they will be wiped out of the market after some time. Like Multani said, that the Ayush sector is growing and at a very fast pace. Why? Because people are manufacturing effective products and people are looking towards the alternate system. I will not say alternate, but I think it should be the main system of medicine in India. So main prime focus should be on quality and then safety and then efficacy. Currently, we are exporting our products to UK, Hungary, USA, Ukraine, South Africa, to name a few. Unless we had followed good quality practices, we would have not entered the international market. In contrast, if Unani manufacturers produce substandard Unani medicine, then the industry as a whole will suffer. It is not just that company that will suffer, but the whole system will suffer. Due to this, the Unani practitioners will not get the desired results in Unani medicines, and ultimately he will lose faith in the system. The customers will also shift to other systems of medicine if quality is not up to the mark. The whole basic is that the whole system will suffer, not just that particular industry. Normally we hear a BUMS says कि यूनानी दवाइयाँ तो काम ही नहीं करती. He will not say that particular company की दवाइयाँ काम नहीं करती. He will say that यूनानी दवाइयाँ ही नहीं काम करती. Why? Because maybe he has used some product of a company that is of substandard quality. Along with TQM, modernization is also very important, whether the change of dosage forms or in packaging. We at Delvi Remedies have introduced sugar-free formulations, keeping in mind the increase of incidence of diabetes. Capsules, sugar-free khamiras, majuns. We are the first ones to launch sugar-free khamiras, majuns. This is one of our products, khamira. This is an Abresham Arshadi. It's basically a khamira Abresham Arshadi in a sugar-free form. It's a production flow chart. What we follow, the SOPs. First, we receive the raw material from supplier, store in quarantine area on plastic pallets, label as under test, send a sample to QC and one sample to outside lab for testing of heavy metal contents. Once approved by both, send the approved store and stack on plastic pallets and label as approved. Issue a batch size of 100 kgs or 1000 kgs, whatever, according to formulation, and send to grinding section along with a flow sheet, which is filled at every stage. All sections, machines will display on a board indicating the name of the product and batch size and batch number. Separately grind the herbs, mix herbs in the mass mixer. This is SOP that I am telling you. Pass in the sieve in 40 mesh sieve fitted with magnetic grill to arrest any iron particle. Send sample to QC, test for bulk density and moisture content. Send to outside lab for micro-analysis. Like Multani ji said that it is very important to have an inside lab. We are working on that. Once approved by both, fill in double polypacks of 25 kg, put the sealed polypack in woven sack, label as Delhi Ayush Jushanda with batch number, manufacturing date, and for gamma radiation. On receipt, after gamma radiation, label as gamma radiated and stack on plastic pallets in the powder filling section. Send a sample to external lab for microanalysis. Once approved, start filling process. Fill powder of 100 gram in bottle through auger filling machine. Check weight of every bottle on an electronic weighing balance. Manual capping of bottle with WAD. Induction sealing. Check every bottle after induction sealing. Clean bottle if powder particles seen on bottle. MRP, batch number, date of manufacturing, date of expiry to be printed on the label through inkjet. Label the bottle, put in printed master cartons of 48 piece and send to dispatch. This is just an SOP that I've said about our filling section. Thank you very much. This is a group of companies. We are manufacturing about 800 Unani products. Thank you very much. And I would like to thank CCREM and congratulations on the Unani Day. Thank you.
Thank you so much, sir. I will now request the chairpersons of this session to sum up and conclude. Sir,
I will say only two words: well done. And with your dynamic DG, Dr. Asim and the team and all of you, we have to make a great day for tomorrow. And I will tell you that the Government of India is supporting fully. Take benefit of it. And that's everybody's duty.
sir, you would like to? Thank you so much, sir. Now it's the time for the felicitations. I will request now Dr. Rahat Raza, in charge RRIUM, to present the memento to Dr. Mohsin Wali. I will now request Dr. Nahid Parveen to present the memento to Dr. Raman Singh. I will now request Dr. Yunus Munshi to present the memento to Dr. Muhammad Khalid. Now, I will request Dr. Ahmed Minhajuddin to present the memento to Dr. N. Zahir. Now it's time to felicitate our speakers. First, I would like to request Dr. Mohsin Wali to present the memento to Mr. Pradeep Multani. Now I will request Dr. Raman Singh to present the memento to Dr. Santosh Joshi. Now I would like to request Dr. Muhammad Khalid to present the memento to Dr. Mohsin Dehelvi. Please. Now I will request Dr. N. Zahir to present the memento to Dr. Nabil Anwar. And that marks the end of the session. Thank you very much for all of you.
Afternoon, everyone. I'm Dr. Tamanna Nazli, Research Officer from CCRU. And on behalf of CCRU, a very warm welcome to all the invited guests and delegates at this International Conference on Unani Medicine for Public Health. Unani Day is an annual event of CCRU. During Unani Day celebration, academia and all stakeholders come together on one platform and hold discussions on this important day. This year, under the guidance of Ministry of Ayush, we are organizing a 2-day conference where experts and delegates from premier institutes of India and abroad will join us in hybrid mode. Before we start, I would like to give a brief introduction of CCRUM. Central Council for Research in Unani Medicine is an apex body for formulation, coordination, development, and promotion of research on scientific clients. We have 23 institutes and units across India. Here, we begin with our scientific session 6 on non-communicable disease, a challenge to combat. May I request our chair, Professor M.A. Jaffrey Sahab, former Vice Chancellor, Jamia Hamdard, Professor Surinder Singh, Professor, Department of Pharmacology, All India Institute of Medical Sciences, New Delhi, and Professor Wamiq Amin Sahab from Department of Ilmul Amraz, Aligarh Muslim University, to chair the session. Sir, requesting you all to kindly take the seats on the dais. Now, may I request Dr. Rahat Raza, Deputy Director, Regional Research Institute of Unani Medicine and in charge, and Dr. Ghazala Javed, a Research Officer and in charge, Drug Standardization Unit of CCRUM, to join the dignitaries on the dais. The reporters of this session are Dr. Anwar Jamal, Dr. Priyanka Verma, and Dr. Zeba Afreen. Before we commence our program, I would like to give a floral welcome to our chairs. I request Dr. Rahat Raza to welcome Professor M.A. Jaffrey Sahab. I once again request Dr. Rahat Raza Sahab, Deputy Director in charge RRAM, to welcome Professor M.A. Jaffrey Sahab. Welcome you, sir. I request Dr. Ghazala Javed to welcome Professor Surinder Singh, sir. I again request Dr. Ghazala Javed to welcome Dr. Wamiq Amin Sahab. Now, may I request Dr. Rahat Raza, Deputy Director RRIUM, to welcome Dr. Ghazala Javed. Dr. Ghazala Javed, may I request you to welcome Dr. Rahat Raza? We have 4 presenters today in the scientific session, and every speaker will be given 15 minutes for their presentation and 5 minutes for taking questions from the audience. May I request the chairs to conduct the session? It's an honor to have you here all. As a chair, may I request you, sir, to take the session ahead?
Very good afternoon. We are already 40 minutes late. So we have no other option but to squeeze all the speakers to cut their slide or cut their personal thoughts, and we are restricted to 15 minutes each. And to start with, we have an eminent pulmonary expert, Dr. Rohit Kumar, who is a faculty at Vardhman Mahavir Medical College at Safdarjung Hospital, New Delhi. And he will be talking about the respiratory disease, which is a major public health challenge. And we will take up all the questions and all the query at the end of fourth speaker, at the end, if the time permit. Dr. Rohit, you're welcome.
Good afternoon, everyone, and thank you for being here. As Sir said, I'll talk about a major public health challenge and something I'm seeing on a day-to-day basis every day. And I actually want this not to be me telling you about my problems, but just to make you think of what we all can do for this. So there are 5 respiratory disorders which are becoming a global challenge, and I'll come to that. There's a global burden of disease. There's a big paper which has analyzed all these problems, and you have tuberculosis. So I am an MD in medicine, but when I joined, when I was doing DM, everybody said, "Tum TB wala doctor banne wale ho." So I'm not a TB wala doctor, but yeah, TB is something that all of us, from an orthopedic surgeon to a gynecologist, everybody of us has to deal with. The TB is there. Then, from a pulmonologist point of view, I have COPD, I have asthma, and the acute lower respiratory tract infections. And this includes the new viral diseases that are coming up. COVID that we've had. Viruses have become the new pandemic, the new plague that we are seeing, and lung cancers. I'll talk about all these disorders. So this is a nice slide which tells us where we were in the year 2019 to where we are now. These are the 10 most deadly causes, worldwide. 3 amongst them are from pulmonary medicine. COPD is the 3rd leading cause of death. You've got lung infections and worst, lung cancer. Amongst all the cancers, lung cancer has the highest mortality that we see. So again, a very, very crowded side. But what I'm trying to put here is look at the origin year of 1990 and how this have changed. We're doing well when it comes to infectious diseases. The infectious disease mortality is coming down. But in fact, the lower respiratory tract infections, which was 2nd, is now the 4th leading cause of death. And it's not really that good, but it's a little better. With tuberculosis, we've actually come from level 7 to level 12, and I'm kind of happy. We've made some advances there. COPD, it is now going up. Non-communicable diseases are actually increasing. Lung cancer has actually increased. So these disorders is what I'm going to be focusing on. And it's not like this is just the global trend. In India, we're part of the globe. We're seeing a very similar trend. So this is a very nice way of showing how diseases are. The areas that is covered by a disease. So we are talking of causes of death in the year 1990. All cause, male, female included, all age groups. And you find, so this was in 1990. This was in 1990, and this is in 2019. And the infectious diseases causes has greatly reduced. Chronic diseases has increased. COPD is now a big cause of concern. So is asthma and ILD. So again, here you see a very similar trend. Some diseases are coming down and some are getting replaced by the chronic disorders. And respiratory disorders are there. So we need to deal with it collectively. Now let's talk about disease specifically. I'll really quickly run through all of them. COPD, we all seen this. COPD is one of the most prevalent non-communicable respiratory disorders. 300 million people, or 4% of the world population, has it. 4% doesn't seem like much, right? Well, let's come to this. It is the 3rd most common cause of death, and death is not something to be taken lightly. It's underdiagnosed and misdiagnosed. So 4% is actually an underestimated value that I'm telling you. It has a high prevalence of severity and has a high economic burden. You've got a lot of patients. Every day I get requests, can you shift this patient to your ICU? Why? Because they have COPD and they were never treated well. Or they were not, it was a preventable thing, but actions were not taken. Again, asthma. Asthma is also a cause of concern. More than 300 million people worldwide have it. It affects all age groups. You have certain variabilities, reason-wise, but all of us, you will have one person in your family or in your distant relatives or in your neighborhood who will say, "Mujhe asthma hai. Can you help me?" So it's not something unusual. You've all seen this. And it is the most common chronic disorder of the children. Now, why I'm emphasizing is we're talking of not just death, but we're talking about the disability that a disease causes. From a childhood, a person is disabled because of his respiratory complaints. If not treated adequately and if not diagnosed, it's a big, big problem that we're dealing with. So it is as with COPD, it is underdiagnosed and worst, undertreated. Somehow, people are not willing to accept what therapies we have. Some are not willing to take inhalers. Do we have something in Unani to help these people? And all these symptoms also need to be managed very effectively so that the person is, is not feeling helpless. Sorry. The burden of asthma is high. Another thing, it's not just about disability. Asthma is causing deaths. And I personally and strongly believe every asthma death is actually preventable. So you have a young person dying of asthma. That's the really sad thing that happens, and the onus is on us as healthcare providers that we should not let this happen. It is all these deaths, as I said, are preventable. Now let's talk about acute lower respiratory tract infection. Again, something I see way too frequently. So pneumonia is causing 2.4 million deaths every year. From 4, it is now the 6th leading cause. But 6th leading cause of death, pneumonia, it's really worrisome. Why? We are living in an antibiotic era. In an antibiotic era, we are not able to prevent pneumonias. We're talking of bacterial pneumonias. We have viral pneumonias also to deal with. And it is, again, a leading cause of death in children younger than 5 years of age. So again, try to, I'm not saying if an elderly person dies, it's okay. Please be very clear, that's not the message. But if a young child is having pneumonia and has to live with the consequences of that pneumonia, he develops a bronchiectasis and has to live his whole life with that bronchiectasis. It's a real horrible thing. So there are, approximately 650, 100,000 children younger than 5 years who are having this, and 15% of death in childhood because of this, and 1 million deaths on elderly also. So as I said, it's not just about children, but it's about the elderly population too. It's the second leading cause of years of life lost. So let's talk about the long-term consequences. So it's not just death and hospitalization. Yes, that's definitely that's a cause of concern. But pneumonia has potential long-term consequences. And again, COVID also taught us this, the long COVID that we're dealing with. Do we have therapies for them? Honestly, there are very few things to offer. Does Unani have anything to offer for my long COVID patients? I really ask you and beg you to help me on this. Then with, strengthening global immunization programs, better living conditions. You have an HIV pandemic, which HIV is also coming, a little better. It's become from an acute illness, it's become a chronic illness. But you've got a lot of patients dying from HIV and pneumonia. So that's another focus area, thrust area where we need to focus our research on. You've got young children having respiratory syncytial virus. And nowadays, viruses have become the new plague, right? So you have, COVID, last 2-3 years, I wish there was a time machine that we could have set it back. Last 3 years have been lost for many people because of COVID. So most of these viruses, influenza has caused pandemics for many years. For centuries, you've heard of influenza pandemics. So these, I'll be honest, we do have very few antiviral therapies. Are there any viral therapies that Unani has? Or are there any therapies that can help you prevent these infections? TB is another problem. As I said, big problem. We've done some good work on it, but the problem is whatever therapies that I have, we still have liver disorders, and Sir has done work on it. And you hear of patients losing their lives because of hepatitis secondary to therapies that we're giving. Are there good therapies that can reduce the hepatotoxicity? So there are a lot of deaths. 6 million men, 3.4 million women, children, all dying because of TB. And we are trying our best to curb the transmission and treat it as well as possible, have dot centers, but we still need to do a lot more on this. And again, we need help from Unani from that. So TB occurs in every part of the world. And let's just skip through this, but what is important for us to realize, another thing with TB. So TB, we've got good medicines, but what about MDR TB? With MDR TB, the problem is the drugs are even more toxic. So I need more supportive management, more hepatoprotective regimes, so that I can give my drugs and the Unani drugs and the patient can live and be healthy. So another thing that we're seeing a lot, lung cancer. Lung cancer is worst amongst all the cancers. I know, yes, last week we had the oncology week. The only thing I wanted to say was, you have people living with cancers. Cancers have now become chronic disorders. But with lung cancer, sadly enough, the mortality continues to be very high. So lung cancer causes more deaths than colon, prostate, ovarian and breast cancers put together. I mean, so that's something that we need to focus on. And with lung cancers, one thing that I really need to bring out is I personally believe that quite a few cases are preventable. If you have air pollution levels under control, if you have good tobacco cessation regimes, you can actually prevent lung cancers. So here again, are there any medicines from Unani which can help us? Whenever a person is quit smokes, he has this urge. Are there any therapies that can reduce that urge or help him quit smoking? And again, repetitive here, but what I'm trying to say is every person who's having lung cancer is actually an economic burden, a burden on his family, a burden on the society, a burden on the healthcare institutions. So, rather than just narrating the problems, I actually want people to come up with solutions here. And there are a lot of other respiratory disorders, occupational disorders. We have a large labor force. We have a young population who's working in very unhealthy conditions. And that's a cause of concern again. Right now, occupational disorders probably are not in the top 5 and top 10 lists, but they are a big problem and likely to emerge further. So inhalation route is a very, very common route for anything to enter the body, not just viruses, but even pollutants and worst, certain dust exposures, which have known to cause a lot of respiratory conditions. This list continues. I'm a sleep specialist also. There's pulmonary hypertension, pulmonary embolism, ILD. One thing that we in fact ignore is an upper respiratory tract infection. We've talked of a lower respiratory tract infection and it causing deaths, causing long-term sequelae. But even an upper respiratory tract infection, I have a lot of patients who are respiratory patients and they have recurrent URTI. Every month, every second month, they come to me with an infection. Is there anything that I can offer them to boost their immunity or prevent these infections? Or having one infection a year is okay. It's challenging my immunity. I'm very happy when I have an infection. I keep telling myself, oh, my immunity is doing a good job. But when a person has it every 2 weeks, that's a problem. We need to help that patient out. So what can we do? Well, there is obvious, these are the standard 8 points that are there that we educate the patient. We have, have good air, reduce the air pollution levels, wear a mask if you're working out. There are quite a few things which are very logical. But the point that I want to focus on is we need to really boost funding on research. And I think all our streams, Unani and allopathic medicines, have to come together to make this a reality. So with that, I'm going to end it here. I hope I've stuck to my time, sir.
Thank you very much. I may invite one or two small questions from the audience side. Okay. If there is no question, good.
Actually, I think I just told problems. I think we want solutions rather than questions. Questions were from me.
Actually, Dr. Rohit Kumar has covered many aspects from very basic things regarding the pulmonary disorders. He has, started from the time of 1990 has covered up to 2019 the scenario of various pulmonary disorders, and he has given good insight of various incidences of various pulmonary respiratory disorders, starting from COPD, asthma, tuberculosis, and other occupational diseases. Just I would like to say that as you have asked the audience that in these areas we the Unani people should also contribute. What may we do? This is a big question before us. So the purpose of organizing such a talks is that it was as an eye-opener for us, because now it's a regime of, in this regime we cannot work, we cannot survive in isolation. It's a time of research of with interdisciplinary approach, and only this can, and this has been proved in the time of COVID, where our potentials have been recognized not only by government, but at government of India, but at international level also. As we have covered, you have asked regarding the asthma. So I would like to tell, we have very good medications in Unani system of medicine. So the need for our youngsters would be to go to our literature, these are time-tested drugs. I have conducted so many animal studies on these drugs, and we have found good results in animal studies also, and we have published also. So for asthma, especially in children's diseases, the results are very nice. As far as tuberculosis is concerned, it has been rightly said that in Unani, though we cannot claim that we have very good, we have anti-tubercular drugs, but the scenario is that whatever regime is followed for ATT, it causes liver damage. It creates so many digestive problems from the very beginning of the starting of the treatment, and if it goes for a long time, so in most of the cases, it creates problems in liver. Only last night, I was discussing a case of my close relative, the Dr. Sareen, director of ILBS. She was a lady of around about 45, 46 years. She took ATT for some joint problems. She was diagnosed tubercular joint problem. Only for 6 months she took treatment, and around about 3 months ago, she started developing jaundice also. But it was her bad luck that we could not be aware of her problem. Otherwise, we would have started some medication also. And last week, they brought the patient from Aligarh to ILBS, and within 4 or 5 days, she could not survive. Last night, I met Dr. Sareen regarding the patient. She said that he is observing that fellow on daily basis, but the condition was very critical. Just I want to say one thing. When I was coming out of Sareen, he told me that, sorry, we can't help, but he told me that I would like to call you again. We want to do something from Unani side of you, because it is a very promising area, and we want to work. I know Dr. Sareen was working on some of our Unani colleagues from CCRM also when he was in Pant Hospital. So the thing is that world is looking towards us, and it would be our duty. And several studies have been conducted in Jamia Hamdard also by our colleagues. They have given some Unani drugs along with the ATT with the help of modern medicine pulmonologists and other consultants, and the results were found very nice, and those studies have also been published. And regarding other occupational disorders and toxicity and viral diseases, I can say that we can offer some very good immunoenhancer if we can boost the immunity. And if we go to our literature, they have given what to eat and what type of air should be there and what exercises they need. And they have given a long list of very small food items, fruits like pomegranate, etc., like dates, which are very good to increase the immunity. So that's why if the studies are started in collaboration, I think it may work very nicely. Thank you very much. Please invite next speaker.
Good. Thank you, Dr. Rohit. The next speaker is Professor S.M. Arif Jaidi. He is a Dean School of Unani Medicine and Research at Jamia Hamdard, and he will be talking about the diabetic food, the Unani perspective. Dr. Jaidi. Request the speaker to be in time, please.
Pardon?
We are very late, so stick to time.
You asked to take 15 minutes only. I will take only 15 minutes.
Thank you.
Since we are talking that diabetic foot ulcers, thank you, with the permission of the chairs, sorry, because time is short. And as you know that foot ulcers are a common complication which do not subside by correction in diet and other things, exercise and insulin treatment only. So that the condition become worse, can't be controlled by on doing this thing. And this is one of the complication in which you see the patient suffered from health and socio-economic problems, and the prevalence of foot ulcer among diabetic is 6.3% around the world. It is estimated that 2 to 3% of diabetic patients experience diabetic foot every year, and it is also a fact that every 30 seconds a foot becomes amputated all over the world. Now you can imagine the severity of the problems and the burden of that. And coming short that we are coming there may be two type of this thing, diabetic ulcer. One is the gangrene, in which there is ischemia only, which is dry gangrene, and the infection when wet gangrene. And the other things may be acute limb ischemia, which is defined as a sudden decrease in limb perfusion that threatens the viability of limb, which is associated with high rate of morbidity and mortality, resulting in gangrene. Ultimately, the result is same. So that acute limb ischemia is the most advanced form of peripheral artery disease, a progressive circulation disorder caused by the plaque, which has happened in the vessels, so that the patient suffer from these problems. And moreover, there is reduced arterial perfusion because of the plaques formation in the arteriole and resulting in dorsal edema and endothelial damage also. So that when patient develop this diabetic foot ulcer, we have to done grading, and there the assessment of the ulcer can be done through a Wagner grades, and Wagner grades run from 0 to 5. 0 means that there is no diabetic foot ulcers, and 5 is an extreme condition of the ulcers. So that as far as the Unani doctors are concerned, nobody turns towards the Unani doctors in between 1 to 3 Wagner grades. Only turn when the patient reaches up to the 4 or 5, means the Unani is the last destination for the patients for their treatment. So that comes under the 4 or 5 Wagner's grades. There are a number of options available, like hyperbaric oxygens, but there is no conclusive evidence for that. There is a negative pressure wound therapy also. Again, there is no conclusive this thing because data is available, but there is no conclusion. There is a ozone therapy. There is growth factors also. There is phototherapy also. There are a number of options available. But despite of having all these things, because there is no conclusive regard for that, we have chosen leech therapy. In the previous one, there is only mechanical effect of by putting the negative pressures or other doing other so. But here we are dealing with some pharmacokinetic properties of the leech also. So that we have chosen that. And moreover, the history of leech application is very old. There is 5,000 years old history. Some documents and found in Egyptian medicine that leech sucking blood from a sick patient could help cure everything, right, from fever to any other things also. And earliest documented record of the leeches being used for remedial purpose appears in a painting in Egyptian tomb of 1500 BC. Nicander of Colophon was of the scientist, and he believes in the leeches so much. He says, when I become sick, rather to go any detail, मेरे body को leech से लपेट दीजिएगा, leech मेरी body का leech छोड़ दीजिएगा. So that the use of leeches was very widespread, and in France, you see there was shortage of leeches in certain European, other than France, certain European countries due to its rigorous use in 17th and 18th century. And by the end of 18th century, France, England, other countries of Western Europe and had depleted their indigenous stock of leeches. This was the picture at that time, or using of the leeches that time also. In 1830, France imported 40 million leeches a year for medical purpose. The next decade, England imported 6 million leeches from France alone. In India, Pondicherry was the center where the leeches exported to that these European countries also. And it was a rule at that time by the British government, for every 100 passengers, so leeches are required in the ships to transport from the India to the European countries. During 1930s, 6 million leeches were used annually in Parisian hospital. There was a big competition amongst the leech vendors. Here you can see the advertisement of the vendors. There was a competition and big competition. So that 4000 साल तक लीचेस का ये रहा, लेकिन उसके बाद में लीचेस का मामला जो है वो ख़त्म होने लगा. And by the end of 19th century, physicians realized that it takes time for blood to renew, and one can in fact lose too much of it blood. It was also believed that the process could make you more susceptible to infection. Just giving the, you see, citation for this excuses the infection, they have dropped the application of leeches, and the bloodletting became vanished, leech application became vanished at that time. And thereafter, in year 2004, again the leech come into existence, and there was a approval, FDA approval for that, and the pupils have started to use leeches. This is the phylokinetics of the leeches. I am not going into details because time is short. You may see through the net also this thing. As I discussed you कि जो enzymes लीच छोड़ता है उसका phylokinetics भी है, और उसमें वो डायलिटेशन को भी कर रहा है, वासोडाइलेटेशन भी कर रहा है, प्रेशर को भी कम करता है, तमाम चीज़ें हैं. So that by taking advantage of that phylokinetics, the leeches, our experiences, we have taken the patient with diabetic foot ulcers. This was suffering with this ulcer and decided to go for amputation, and patient admitted by us in the hospital, and certain medications, Unani medication, oral medication, along with the local dressing of unripe papaya, because unripe papaya has a phagocytic actions, was done on daily basis. मैं आपको एक चीज़ ये शेयर करूँ, जब ये पपाया का 10-12 साल पहले मैंने शुरू किया तो मेरी समझ में नहीं आता था कि किस तरह से करें. तो सर्जिकल ब्लेड से लेकर के बहुत स्मॉल फ्लैक्स हम काटते थे और वुड पे लगाने की कोशिश करते थे, लेकिन वो रुक नहीं पाता था उसके पे. देन आई आस्क्ड ए पेशेंट के वो होता है घिसने वाला, जिस पर नारियल घिसते हैं, वो लेकर आओ. मैंने बड़े देखे थे, छोटा कभी देखा नहीं था. तो पेशेंट गया मार्केट में, छोटा सा लेकर आ गया, एंड आई बिकेम हैप्पी, क्योंकि मैं उसको ट्रे के अंदर रख करके स्टरलाइजेशन के लिए भेजना शुरू कर दिया. एंड सिंस दैट हमने उस पपाया को उसके ऊपर क्रश करके उसका एक पेस्ट जैसा बना लिया, और उस पेस्ट को सूंड के ऊपर लोकली लगाया करते. ये 10-12 साल पहले का मुझे आज भी याद है कि वो उस मुश्किल से गुजरे, फिर बाद में फिर हमारा ये हुआ. सो दैट पेशेंट वाज केप्ट ऑन ओरल मेडिकेशन, और नीम वाटर से वुड का हमने वॉशिंग किया उसका. और ये पिक्चर 1 हफ्ते के बाद में ली गई, जिसमें आप देखते हैं कि वुड से ब्लीडिंग हो रही है. दिस पिक्चर वाज टेकन आफ्टर 1 month, एंड द वुंड इज अंडर हीलिंग प्रोसेस. This picture taken after 1.5 months, and this wound have shown further sign of improvement. This picture taken after 2 months, and where you see the wound is completely healed. This patient come with the muscular atrophy and using a lathi stick for walking, and goes back without lathi. एक्चुअल में टाइम इतना शॉर्ट है कि ये कई महीने का काम 1 मिनट में समझाने में मुझे खुद ही तकलीफ हो रही है वैसे आपको. This is another patient which has again asked to go for amputation. Patient came to us from Apollo Hospital, और वो गैंग्रीन के उसके फुल ब्लोन साइन थे, बहुत ज़्यादा स्मेल और पेन भी था. पेशेंट को सीवियर पेन था. पेशेंट वाज ऑन पेन किलर इंजेक्शंस. इनिशियल 1 वीक हमने पेशेंट्स को उसी इंजेक्शन पर चलने दिया. नेक्स्ट वीक में हमने पेशेंट को ओरल पेन किलर पर ले आए, और 3rd वीक में उसके पेन किलर्स हमने बंद कर दिए. उसके सारे एंटीबायोटिक आफ्टर एडमिशन हमने बंद किए थे. दिस पिक्चर वाज टेकन आफ्टर 3 weeks, एंड यू कैन सी द सेल्फ हैज़ गॉन ऑफ, बिकॉज वी आर डूइंग ऑफ द ripe papaya over the wound every day. And by the end of 3rd week, patient became free from pain, and bad smell has also vanished. And this is the demonstration of the leeches over the food. This is the same patient, and this picture taken after 6 weeks. Here you can see कि 3 wound में से 1 wound तो heal हो गया है जो टो के पास में, बाकी 2 wounds you can see that, and still there is no bad smells. And this picture taken after the completion of 9 weeks, where you can see the wound almost healed. And this picture taken after the completion of 12 weeks. And patient discharged, and patient became on foot. Here you can see the picture, patient standing in between, and paper published in international wound journals. This is another patient of gangrene right toe. This picture was taken after 2 weeks, and this again 2 weeks, and this picture taken after 4 weeks. Here you can see the wound became completely healed. This is another case of you see wound right foot, and wound became composed, and there numerous maggots has happened in the wound, and the same treatment given to this patient also. This picture taken after 4 weeks, and there are sign of improved change in that picture, and this picture taken after 8 weeks. In between बहुत सारी pictures जो मैं आपको दिखाने की कोशिश नहीं की, टाइम की शॉर्टेज की, इसलिए मैं आपको 1 महीने या 15 दिन के गैप की पिक्चर्स दिखाता हूँ यहाँ पर. Healthy granulation इस पिक्चर में आप देख सकते हैं, and this is taken after 12 weeks, and this picture taken after 14 weeks, wound becomes completely healed. And this is the, you see, another case. Apart from this diabetic foot ulcer, I have taken a case of thrombosis. बस मैं 2-3 मिनट में फिनिश कर रहा हूँ, टाइम पूरा हो गया इसमें बता के. And this patient was suffering from toothache, so that for the toothache patient went to a doctor, and doctor has given IV injection. But after giving injection, patient was having severe pain in the right hand, and that hand became bluish. So that patient went to a medical college there in Allahabad and admitted, and thrombectomy done. At that time, the patient was asked to go back home. But after going back to home, this bluishness was continuous. There was severe pain, and patient was on painkiller injections. So that patient contacted to us and come to Delhi and admitted in our hospital after that situation. Here you can see that this is the condition of the hand, and ये पूरे हाथ पर उसका swelling था, and it was decided there that patient has to go for amputation above this elbow. So that again the same treatment was given, and you can see the other picture. This picture taken after 3-4 days of the admission. And here I am trying to show you the branches of the brachial artery. You see the one artery is a radial artery, another one is ulnar, and in between the interosseous artery. And this is the color Doppler of this patient. Here you can see the radial artery is there, but neither the ulnar artery can be seen nor interosseous artery can be seen in this picture also. This is what the situation. And this picture was taken in Apollo Hospital. Before going to the Apollo Hospital, patient goes to the AIMS also. हमारे पास 24 घंटे रहा, और उसने कहा जी नहीं दर्द बहुत ज़्यादा है, मुझे भेज दो, और हमने उस पेशेंट को भेज दिया. And again came back after you see going to AIMS in the casualty, and they asked come in the OPD and you have to go for amputation. और हमारे पास दोबारा आकर एडमिट हुआ, और उसके बाद में फिर 2 बार फिर अपोलो गया. So that this Doppler was done in Apollo Hospital that time also. Again patient remained with us for a longer period, and this is the report of that patient. And you see after the treatment the swelling has gone off. Wrinkles can be seen over the arm here, and here also you can see ये स्किन इसकी बिल्कुल फ्राइबल थी. यू कांट टच द स्किन. सारा स्किन बिल्कुल इसका गल चुका था. आप कर जब स्किन ठीक हुआ तो हमने पेशेंट को ग्लाइडिंग कपिंग भी कराया उस टाइम पर, स्किन ठीक होने के बाद में भी, और लीच थेरेपी भी हमने चलाई बिसाइड यूनानी ट्रीटमेंट. सो दैट यू कैन सी दैट ऑल द इन्फ्लेमेशन हैज़ गॉन ऑफ. एंड लास्ट में आकर जो पेशेंट की सिचुएशन थी, द प्रोसेस बिकेम कम्प्लीटली स्टॉप and only limited up to the phalanx. ये उसका हाथ जो ये एल्बो एम्पुटेशन होना था वो सिर्फ phalanx तक ही लिमिटेड हो गया. और so that number of patient we are attracting, this patient was admitted just just 1 week back, goes back again and again admitted for 3-4 days back. और इसको अभी 2 सिटिंग हो चुका है. नेक्स्ट पिक्चर जो मैं इसका आज लाया था वो शायद इसमें आ नहीं पाया स्लाइड के अंदर, अदरवाइज मैं दिखाता कि देयर इज़ डिफरेंस इन बिटवीन. देयर इज़ यू सी साइन ऑफ हीलिंग इन दैट वुंड आल्सो. सो माय टाइम इज़ ओवर. थैंक यू वेरी मच फॉर लिसनिंग. यू कैन सी हियर आल्सो.
I would just make a small comment because time is short. These type of, actually, I know Dr. Zelli personally for a long time.
Thank you. Thank you so much.
Just one small question. Is that papaya the ripened one or what?
Unripe papaya. Unripe papaya.
Unripe papaya.
Yes.
And you just squeeze or
Just crushed over that crusher and put over the wound. Sometimes alone. Initially it was kept alone, and thereafter along with the honey also.
And you give antibiotic also?
No antibiotic at all. No antibiotic, no painkiller. Nothing. Only Unani medicines.
I think this type of study can be better combined with all surgical emergencies as a add-on therapy. Suppose it took 2 months or 1 month to clear it off, but if it is add-on with the antibiotic, high-end antibiotic, what we are doing in a allopathic hospital, that can be cured within a limited period of time.
You see, perfection sterilization is important.
Yes.
If we are doing proper sterilization, there is no need of antibiotic, and that is very difficult to keep cap.
My question is
तो
this:
antibiotic की जो आप बात
if the
कीजिए,
local and antibiotic comes together, or
local antibiotic,
local
antibiotic,
systemic antibiotic.
Systemic antibiotic.
Systemic antibiotic.
That can.
So that means that can be cured within
No
2
doubt.
weeks instead of 4 weeks.
That can.
What were you doing? Actually, I think you have told initially, just as soon as the patient comes, I think you don't stop immediately.
Yeah.
You just must be tapering of the antibiotics.
You see, depends upon. Supposing the patient is having high TSA, patient is having fever, so that we conclude that patient is having infection.
Yeah.
So that हम कहते हैं कि antibiotic पे जाने दीजिए. The patient which we received having only wound, smell and pain also, and she was on augmentin that time and painkiller injection. हमने उसका augmentin immediately stop कर दिया, लेकिन पेन किलर इंजेक्शन को बंद नहीं कर सकते, तो उसको चलने दिया. एक वीक के बाद में जब पेन का इंटेंसिटी कम हुआ तो ओरल मेडिक पर ले आए हम पेन किलर पर, एंटीबायोटिक नहीं स्टार्ट किया.
Why don't you plan for complete randomized this type of trial so that it can be better used? Actually, diabetic food and gangrene, it is a big problem. It is a big problem, and even thrombus is a big problem.
Of course.
So why don't you plan randomize along with any major hospital and all that?
Yes, बिल्कुल हो
I
सकता है.
think this is the actual fruit of getting these type of conferences if there is a collaboration of this type.
And these are not the only cases. There are numerous cases which has been treated by we people. और एक्चुअली और बड़ा डिलेमा क्या है, मैं आपको एक मिनट और लूँगा आपसे. एक हमारे पास में पायलट आया, उसका गैंग्रीन हुआ, बहुत सारी फैसिलिटी है, मैक्स और फोर्टिस में सब कुछ. अल्टीमेटली उसके फादर ने तलाश करके हमारे पास में ले आए, RRI अखला में भी गए, उन्होंने कहा जैदी साहब के पास चले जाइए. उसका ट्रीटमेंट मैंने किया, सर्टिफिकेट वहाँ से लेता था वो फोर्टिस से. मैं पूछता था वहाँ क्या जाते हो, कि सर जब मैं जाऊँगा अपने उसके लिए मेडिकल के लिए तो वो एक्सेप्ट नहीं करेंगे, उसी का एक्सेप्ट करेंगे. तो सो आई ट्रीटेड दैट पायलट and certificate taken from the Fortis hospital. This is dilemma.
That's why, let it be official, let it be official.
Yes.
But he has presented this type of presentation at various levels.
Also he has given an interview. उसने कहा ये नहीं बताऊंगा पायलट हूँ, लेकिन इंटरव्यू दूंगा कहाँ मैं यूनानी सिटी.
Thank you very much.
Thank you so much.
The next speaker is Professor Jamil Ahmed. He is from the Aligarh Muslim University, Aligarh, and he will be talking about the role of Unani medicine in the management of skin disease, and which is an evidence-based approach. Yeah, Professor Ahmed.
Assalamu alaikum. May I start? With the permission of the chairpersons, actually I am here to share my experience as a lesson, because many of the my teachers are present over here. Professor Jafri Saab, Professor Wamiq Amin Saab, Professor Zaidi, all are my teachers during my graduation. Dr. Ghazala is my colleague, Rahat Raza Saab my senior. उस्ताद के सामने बोलना थोड़ा मुश्किल काम होता है.
चलाइए और सामने देखिए, सामने देखिए।
ऐसा लग रहा है कि वायवा देने खड़ा हो गया। Actually, this is the clinical experiences which I learned during my clinical practice of around more than 22 years. When I was appointed as a lecturer in the Department of Skin, which was bifurcated and curated by the CCIM in the year 2001. Where to back? Yes. The role of Unani medicine in the management of skin diseases. ऐसा कहा जाता है कि स्किन का मरीज़ जो है वो कभी ठीक नहीं होता और कभी इमरजेंसी भी नहीं होती, लेकिन मुझे ऐसा लगता है कि ये दोनों बातें गलत हैं। स्किन के तकरीबन अल्हम्दुलिल्लाह सभी मरीज़ ठीक भी होते हैं और टाइम भी कम लगता है इफ़ वी गो फॉर द यूनानी मेडिसिन। तो एविडेंस इज हियर। Actually, what we do in our practice when the patient of skin come to us, we maintain the equilibrium of the akhlat of a particular patients as per their requirements. In modern sciences, this is known as homeostasis, which is Greek word coined by a physician in the year 1930. We try to maintain or attain or normalize the equilibrium of the akhlat or homeostasis. This is the method by which we achieve our target. First of all, we try to make izala sabab. Izala sabab means remove the cause, removal of cause, elimination of the cause, by means of elimination of the cause, predisposing factors, leading to the normalization of akhlat, which in turn benefited in the form of normalization of the tissues. यहाँ मैं सिर्फ evidences दे रहा हूँ. I am trying to present evidences. This is the case of alopecia. He was diagnosed alopecia areata. He is a student of BTech, AMU, presently studying in AMU, and came to me, and I provided Unani medications for alopecia areata, and he was cured. This is another case of tinea capitis, which was treated successfully with the help of Unani medicines. I never use any other medicines other than Unani medicines. These patients have been treated only with the help of Unani medicines. Another case of tinea capitis, which was treated within a short period of 2 to 3 months only, not taking much of time. This is the small girl. This is the case of atopic dermatitis, having the immunoglobulin E level more than 4,000. Symptomatically, she was relieved within 2 to 3 weeks, and now her IgE level is gradually becoming towards normalcy. Some of the patients I collected to present the role of Unani medicine in the form of evidences. This is the scalp of that same baby girl. This is the case of chronic eczematous dermatitis. he was suffering from this disease more than 10 years, or within a period of 3 to 4 weeks, he becomes almost normal. This is a case of tinea corporis actually, along with secondary infection. Within a period of 3 to 4 weeks, this is the result. Pre and post, both photographs is displays over here. This is the case of hyperpigmentation melasma. A lady come to us with the pigmentation on the face, the day-to-day problem. We have developed a cosmetology lab in the Aligarh Muslim University. We have started there a therapy, a named therapy, the Kate Basure Labniya therapy. Kate lawn therapy. This is the case of Kate lawn therapy. I made some gel form medicines and applied to this lady. Within 2 weeks, her face is glowing. This is another case of acne vulgaris, treated by that another kind of therapy which I introduced there. Very quick action, quick results, satisfactory responses of the patients. Again, this is the case in my early period.
I'm sorry, I'm asking in between, otherwise it will be too late. I think this is a scientific forum.
Yes.
And you are telling Unani medicine.
Yes.
I think you have to speak out which type of Unani medicine.
Yes, I can describe. Actually, I am present.
We will forget, na, which particular medicine is for the acute dermatitis or for acne or for what?
Actually, there is no single medicine which is being used in a particular patient. There are set of medicines as per the requirement of their usul-e-ilaj. We make a holistic approach to the patients. If a patient of acne vulgaris suppose came to us, we prescribe a formulations for internal use.
My query is not this. My query is this. It is a scientific form, and the purpose of this scientific form that if you are working on a drug, suppose a drug, and if anybody is working on a drug, they can question or counteraction, or they can support your theory. Unani medicine is a very big one. So can you come down to a closer?
Sir, of course, I can name all those medicine also. Just 1 or 2 minutes to finish it with it. This was the case of gangrenous ulcer, which was advised amputation and treated. He is running his shop in near Karol Bagh, Bidanpura. Her leg is saved, which was advised in Gangaram Hospital for amputation up to knee. This is another case. He is a pharmacist in front of ILNJP. He was having venous ulcers and was treated. This is the case of exfoliative dermatitis. He is doing BSc. No, I'm not telling his name or face also. This is the success stories of various type of patients. This is the case of psoriasis, pre and post. I am just highlighting the role of Unani medicines in the management of various skin diseases. How we can. This is also the case of psoriasis with eczematization, scalp psoriasis with eczematization, psoriasis again. This is the post-psoriatic hypomelanosis. Again, the same patient of psoriasis.
Please bind up.
Okay, sir. This is the case of eczema, tinea faciae, tinea corporis, tinea. Thank you. Now I can tell Unani, the Unani drug which is being used in any of the patient if you want.
It's not a question of if you want. You are presenting your work at a scientific forum. Purpose should be clear. People should know. As your previous speaker, Dr. Zaidi, was telling, he is using papaya in that form, in that form. The thing is that it is not sufficient to say that your Unani medicine has done this, the Unani medicine has done this. Nobody is getting anything from this is the thing. No need to present several cases. Just put 4 or 5 cases and tell what you have used and what is the result. This is the ultimate thing. And this should be done at a scientific forum. Without
So
that,
I think we should.
thank you. I think we should.
ये शायद इस फोरम के लिए सही मुनासिब लेक्चर नहीं था, लेकिन whatever I did, I presented as per the requirement of the topic. I was to highlight the role of Unani medicine in the various skin diseases, which I did. And anybody want any kind of help, treatment, medications, yeah, jankari, some of the papers are already have been published in many journals. Thank you.
Thank you.
I think the scientist should have a capacity to absorb questions. If this behavior continue with the other forum, this is my, as a brotherly advice to my fellow scientists. If anybody is asking questions, one must answer. And there is no question of annoyedness or angerness that this form is not suitable for my research. I think this is an insult to this form. No, sir. I'm sorry to say. You said like this. This is an insult to all the audience, all the dais people, that instead of answering your question, you are blaming that this form is not suitable for my lecture. I am sorry. I am sorry. We are not here to receive memento and all that. We are here to promote Unani medicine as a strong pillar of health and public health. I invite the next speaker, Dr. Ahmed Ali. He is from the Department of Life Sciences, University of Mumbai. And he will be talking about the suppression of sugar toxicity by fruit extract of Tribulus terrestris. Professor Ali.
Very good afternoon to respected chairs and my dear friends, and till the time it is set up, I'm Dr. Ahmed Ali from Department of Life Sciences, University of Mumbai. I have just entered into the field of Unani research. Basically, I'm a biochemistry person, and the reason behind entering is I have submitted a proposal to CCRUM and it has been sanctioned. So it's a very interesting area for me to enter into. Yes, thank you. So without spending any time, I'll be talking about suppression of sugar toxicity by fruit extract of Khare Khasak Khurd. The botanical name is Tribulus terrestris. Next, please.
So this is the overview of my, I'll not deliberate on, next. This one. Yeah. So I'll not deliberate on diabetes. It has become a household term for everyone. The only thing is that it has becoming a cause of worry for all of us, especially less developed countries or the countries which are developing. So we all know that diabetes is associated with hyperglycemia, an increase in the abnormal level of glucose. And the modern theory of diabetes suggests that the diabetes or secondary complications of diabetes are because of the oxidative stress and glycation. I'll not be talking about oxidative stress because we are talking about oxidative stress. I'll be focusing on glycation. So this term is simply defined as a simple or a spontaneous non-enzymatic reaction between the carbonyl group of the sugars and the amino group of the nitrogenous compounds, especially proteins and DNA. So because it is an uncontrolled process or unregulated process which happens during the hyperglycemic condition, it happens during the normoglycemic condition, but the causes or consequences are reflected more in the hyperglycemic condition. So we can see that this is sugar, the carbonyl group of the sugar and amino group of the proteins interact, and in the several stages they lead to the formation of a group of heterogeneous compounds which are known as advanced glycation end products, and they have been implicated in several disorders. For the mass like us, the one term which is equivalent to this glycation process is glycated hemoglobin, HbA1c, and has been used as a biomarker for diabetics. This gives a history of almost several weeks because the half-life of hemoglobin is almost 3 to 4 months. So this protein, when there is hyperglycemic condition for several months or several weeks, the protein has sugar bound to it, and it alters the binding of sugar, alters the structure and function of the hemoglobin. So these are the pathophysiological conditions where glycation has been implicated. You can see aging, diabetes mellitus, cardiovascular diseases, and so on. The basic mechanism behind the toxicity of this sugar or glycation is it leads to the alteration of the structure of the proteins, like precipitation, cross-linking, aggregation, and generation of free radicals, and the damage to DNA. Body has a system to regulate this. As I mentioned, that normoglycemic condition also glycation happens. So we have aldehyde reductase, glyoxylase, and amidoryases. There are proteasome systems. There are so far we have only one drug which has been approved to take care of this kind of event, that is aminoguanidine, but it has been shown to have its own side effects. Vitamins like pyridoxine are shown to have potent inhibitory effect on the glycation process. So Kharikhas Khurd has been used in the Unani medicine. Various parts of this is used. It goes by several names, Gokchura or Gokhra. So a recent review has been published from CCRUM which details about the pharmacological and other effects of this plant. I'll not go into detail, but there has not been any significant report on the anti-glycating and the downstream processes of glycation. So what we have done done some basic characterization. This is we have prepared two extracts, ethanol and ethanolic and aqueous extract, and we have shown that there is a very high antioxidant potential. So browning is a phenomenon which is known by common mass in industry, that is equivalent to the glycation or Maillard reaction. That gives an idea about, and that is what we see in our kitchen also. When we cook the food, the interaction between the sugars and protein leads to the browning of the food items. So we show here that the red line indicates the amount of browning generated by the in vitro incubation of BSA plus glucose, you can see that the presence of aqueous and methanolic extract have suppressed the browning. Then we moved on to the measurement of early glycation products. Here also we could show that the suppression is by more than 43% by aqueous extract and 34% by methanolic extract. Then we went to measure the advanced stage, that is carbonyl content or protein oxidation content. So here also we could show that this effect is because of the anti-glycating property as well as antioxidant property. So it has been suggested that many compounds which can act as antioxidant can also act as anti-glycating molecules. Some of these advanced glycation products are fluorescent. So we have used fluorometric techniques, and as we can see that there is an increased production of fluorescent edges and consequent suppression of the fluorescent edges by the aqueous and methanolic extracts of tribulus or Boxura. Glycation also induces aggregation. That's how it is involved in the neurodegenerative disorders. So we can show by a fluorimetric method where we have used thioflavin T, we can show that there is a suppression of glycation-induced aggregation also by this. We have done SDS page, another way to prove that, to substantiate that the structural alteration of the protein is prevented by the presence of extracts of tribulus or khare khasak. Glycation also causes damage to the DNA, and this process is known as glycoxidation. So these are the glycation-induced processes. And here we have used a very simple method using PBr322 plasmid. And we have shown that the conformation of plasmid changes when the glycation is introduced in the system. But when in the presence of extract, we could show that there is no damage or reversal of the damage of the DNA. So here we propose that the extract could suppress the glucose toxicity at all the stages, and the process we have measured is glycation. So we are making this. So coming to the conclusion, we can show that it has prevented the suppression of the glucose glycation at all the stages. And aqueous extract, fortunately, was found to be more potent as compared to the methanolic extract. So I acknowledge my students' work and collaborators and funding from various agencies, including CCRUM. Thank you for your kind attention.
I think it is a complete scientific study, which is very well appreciated or very well added by the concept of SDS base, especially myeloid beta, immunity, and diabetes. What was the dose?
Thank you, sir. Sir, we have used 1 mg per ml. Yes, sir.
Are you planning to go for any animal study?
Yes, sir. We are going for animal studies, and as well as in the literature, there are various formulations of where khare khasak is used. So we will be using for the evidence generation.
Yeah, good compilation.
Thank you, sir. Thank you, sir.
Since we are using khare khasak as a whole herb,
Yes, sir.
by extracting the compound from it, don't you think that although it becomes more potent, but what about the toxicity?
Sir, we have not isolated the bioactives. We are using the whole extract.
But we are using whole herbs as a powder form.
Yes. So
खैर powder form we use करते हैं as a whole herb.
So
उसका extraction हो जाता है. That will be extract, ethanolic, methanolic, whatsoever.
Yes.
So you get extracted the biomolecule, isn't it?
Yes, sir.
Whether through aqueous extraction or ethanolic extraction. तो उसका toxicity देखना जरूरी नहीं है.
Yes, sir. So when we go to animal studies,
I think it is a valid reason for this question. As far as the CCRM is also concerned, CCRM is looking after both safety and efficacy part. So you have to take care of safety also.
yeah, we'll be doing it, sir. And in the literature, it has been reported for various of the formulations also.
It is very
Yes,
well
sir.
known drug, already used in many formulation of other Ayurvedic formulation. And
Yeah, Ayurvedic also, yes, sir.
But you have to take care of toxicity also.
Yes, sir.
Just, I think you have used aqueous extract
Yes, sir.
and as well as alcoholic extract.
Methanolic.
Methanolic.
Yes,
Okay.
sir.
You have told that the aqueous extract was found better than
Yes.
methanol. Have you tried to use the hydroalcoholic extract also or not?
No, sir. We have not used it.
Because at that thing, many things can come. Both the type of constituents can come in
Yes, sir.
hydroalcohol. It is
Yeah.
as you.
Yeah, thank you, sir. Thank you, sir. As I mentioned that.
Yeah, it depends on polarity, no doubt.
We can ask a question from all the four speakers if you have. Already we are late, but we can take question or advice or suggestion from any audience for all the four speakers.
I'm done.
Thank you.
Thank you, sir. Thank you.
If not,
Basically, the previous speaker, Dr. Zamir Saab, would have presented best way as a case series, if he would have presented. It is a case series, what you presented as your own that achievements as a Unani medicine in skin disease. But if you would have published it or presented as case series, that would have made it scientifically better.
I do agree. Sir, do agree. I am just bridging the gap between you and the scientist.
I was thinking not to speak at this moment.
Just bridging the gap.
I would like to say that I know personally that you are doing a marvelous job. You are doing good work in skin. But the thing is that people at such time दो बातें हैं. एक जो last word में कह रहा हूँ उससे पहले people at such type of work wants to know what is being used and what is the
पानी गिरा हुआ है
advantage of using that particular
ये देखो ये पानी गिर गया
दूसरी सिंपल सी बात ये है पर्सनली स्पीकिंग
ये ना कुछ कर दीजिए
फॉर मी आल्सो मैं भी बहुत सी यूज करता हूँ पेशेंट में जरूरी नहीं है कि मैं हर चीज जो यूज कर रहा हूँ बताऊँ लेकिन अगर मैं उसको उस फॉर्मुलेशन को अपने तक रखना चाहता हूँ तो फिर मैं किसी फोरम पे नहीं अगर जब हम फोरम पे कुछ पेश कर रहे हैं तो जरूरी नहीं कि आपने कितने अच्छे केसेस दिखाए सारे स्किन डिसऑर्डर्स के हो सकता है बहुत अच्छे रिजल्ट्स मिले हों आपको लेकिन पूरे हॉल को किसी को नहीं पता कि किस चीज का क्या फायदा किस दवा को यूज किया इसलिए ये कहा गया जो इनका क्वेश्चन वेरी ठीक है ना मैं बैठा हूँ सोचता हूँ कि आप आगे ध्यान रखेंगे थैंक यू
Thank you all speakers for your presentation and taking time out from your busy schedule. Now I would like to conclude this session and I request our chairs to now present the mementos to our speakers as a token of gratitude. May I request Professor M.A. Jafri Sahab to do the honor of presenting the memento to our first speaker, Dr. Rohit Kumar. Thank you, sir. May I request Professor Surendra Singh, sir, to do the honor of presenting the memento to our next speaker, Dr. S.M. Arif Zaidi Sahab. I request Professor Wamiq Amin Sahab to give the token of appreciation for to Professor Zamir Ahmed Sahab. I would like to request Dr. Rahat Raza Sahab to present a memento as a token of appreciation to Dr. Ahmed Ali Sahab. I request you once again, Dr. Rahat Raza, to present a token of appreciation to Dr. M.A. Jaffri Sahab. Sir, आपका हो गया? I request Dr. Ghazala Javed to present a memento as a token of appreciation to Dr. Surinder Singh sir. I request Dr. Ghazala again to present a token of appreciation to Dr. Wame Amin Sahab. I request Dr. M.A. Jaffri Sahab to present a memento to Dr. Rahat Raza Sahab. I request you, sir, to present a token of appreciation to Dr. Ghazala Javed.
पूरे में भर दिया पानी पानी पी लेगा ये बना थोड़े से तो कर लो खत्म पहले यूनिट पता ना लगा तो ठीक है
Thank you very much, sir, and all the distinguished delegates for being here with us today. On that note, I request one of the chair to conclude this session, and I thank the honorable chairs and request all the members and delegates to remain seated as we will commence our next scientific session immediately. बिलाल भाई सारे हैं सब लोग क्या हुआ? कौन कौन है? चेयर्स तो ला रहा हूँ। हाँ, ये चेंज कर दो। डॉक्टर कुमुद बल्ला, मोहम्मद महफूजुल हक है, प्रोफेसर सैयद इमामुद्दीन। नहीं नहीं, मैं देख रही हूँ सब है नहीं है। ये मेरा काम थोड़ी ना है। Welcome, sir. I request Dr. Kumud Bala, madam, to welcome Dr. Yunus Munshi Sahab. We have four presenters today this technical session. As I said earlier, every speaker will be given 15 minutes for their presentation, followed by 5 minutes for question and answers. May I request the chair to conduct the session? It's an honor to have you all here as a chair, and I request you to take the session ahead. Yeah. Sir, may I request the chairs to conduct the session? And with this, I request the chair to call the first speaker of the session, Dr. Mohammad Imtiaz Hassan, Assistant Professor from Center of Interdisciplinary Research in Basic Sciences, Jamia Millia Islamia.
Okay. So can I start? Okay, good afternoon everyone. It's my pleasure to speak on the dais of CCRUM, especially the Unani medicine. This is because I got first project last year, and since then I am well connected with this agency, and I am really thankful to the organizing committee for inviting me and giving an opportunity to discuss my research, which is purely on the different dimension, but the whole aim of this research is to connect the Unani medicine with the cutting edge modern sciences. So we are going to talk about the identification of microtubule affinity regulating kinase inhibitors using the Unani formulations. And for the today's talk, I have taken Brahmi. It is one of the plant, and their extract has been used as for the neuroprotection and the neuronal health, and it has been suggested to be used for the treatment of Alzheimer's disease. So as you know that the cases of Alzheimer's disease and especially the neuronal diseases are emerged day by day, especially due to the COVID times. The neuronal health problem is arisen and it's increasing globally. You can see here from the global overview, and you can find that especially in the subcontinent region we are facing the dramatic increase in the neuronal cases death. So the Alzheimer's disease fact and figure, if you see that the since 2019 to 2050, you just see that the how many rise in the person per case estimated growth in the number of people of the dementia from 2019 to 2015, and you can see a dramatic increase in the cases. And also it is the very interesting disease in terms of the pharmaceutical industry, because the number of cases are increased. That's what they have the very good market, and their market are going to be increased in trillions and as estimated. And you know, it's very surprising to know that every 3 seconds some people in the world develop dementia. So that's the great challenge. Now if you go to through the module or through the cause of the Alzheimer's disease, of course there are several causes, but among them you can see the hyperphosphorylation of tau. This is one of the hallmark of the Alzheimer's disease, and of course there are so many other reasons for the Alzheimer's disease, but because of the time limitation, I am not going to talk about all these things, but we are going to talk about the tau hyperphosphorylation, because one of the major hallmark of the Alzheimer's disease, and that lead to the Alzheimer's. And if you go through the detailed mechanism, you can see that the destabilization of microtubules and the tau proteins, because of the hyperphosphorylation, forms the neurofibril tangles, and that accumulated in the brain, and that lead to the Alzheimer's disease. And in the other case, you can see that as the stage of the as the increase in the tau aggregates in the brain, that is the directly associated with the pathologically and clinical manifestation of the dementia. So it is already well established that the hyperphosphorylation of tau protein is associated with the dementia, and that lead to the Alzheimer's disease. This is the detailed mechanism where you can see that the once aggregate form, then it affects the other neuron and it causes the neuronal toxicity, and that lead to the Alzheimer's disease. Now the next component is the Unani medicine that you all know, since it is the dice of the Unani medicine, so I am not going to talk about what is the benefit. You all know that is one of the very important science, and the purpose of Unani medicine to assist natural power and thus eradicate the disease, and it is the one of the medication where we are pursuing the less side effects. And they have of course several health benefits, and that's what it is the appreciated since the ancient time till now. Unani medicine plays a significant role in the human survival. Now the question that what are the scientific value of the natural products, especially the Unani formulation. So we know that these are the most complex and fascinating chemical structure that we are getting in the natural products. Then they present actually they are produced by our genome. They are encoded by our genome. That's what it having the very beautiful setup and beautiful structure that could be highly assisted with the highly acclimatized with our body. And the natural biological activity of the simple compound or chemical or a mixture of components, both the way they can give you the best outcomes. So it can be effective to the different cases of human diseases. Either you have to fight the disease, either you have to protect from the disease. Now if you go through the drug discovery pipeline, you can know that drug discovery pipeline follows a particular trend, that is from the identification of lead molecule till the development of molecule. In that context, protein structure, because protein is the functional unit of our body and that perform a large number of function, and the three-dimensional structure of protein plays a significant role. So if we will be able to understand the three-dimensional structure of protein, we could know how the ligand or how the any inhibitor, how the any phytochemicals could bind to the target protein, and that would lead to the your modulation of the activity, whether you need to activate or inhibit, whatever you want, accordingly you can get that kind of activity. Now the basic question is that the people from the Ayurveda or the Unani medicine, they work on the basic principle, the impact of drug. If you are giving something, you are getting some beneficial outcome, you would say it is a drug molecule. But the modern drug discovery is started with a different angle. It is started with the understanding the pathobiology of disease. Then we identify the potential drug target. If those targets are really playing significant role in the modulation of disease, then we try to search a molecule that could modulate the activity of this one. So now the two different disciplines, I am trying to merge the both disciplines together and come up with the new flavor and new outcome of our research. So the main aim of my research is to connect the Unani or Ayurveda with the modern computational sciences or modern drug discovery methods. So our lab is working on the three different setup. One is the NGS-based functional genomics approach, other is the structure-based drug discovery, and third part is the protein folding and dynamics. And for the structure-based drug development, we are using several kinases. And today I'm going to talk about the one of the kinase that has been used for the used as a drug target for the Alzheimer's disease. So before going to that, we must know that the kinase are the protein molecule, they are the enzyme, and which is phosphorylating the other protein. But this is the simple role of the kinase, actually control almost all biological activity of human system. All the phenomena, biological phenomena, almost all phenomena is regulated by the kinase activity. And if you go through the drug targets, list of the drug targets, this is the second to GPCR. GPCR comprised of 33% of the total drug target, and this is comprised of 30% of the drug target. It means for the targeting, especially Alzheimer's disease, cancer, and all those things, I just listed the role of kinase in the different drug, different diseases. And you can see that in the cancer, because they are modulating several pathways, and through that it modulates the cancer. Similarly, in the tauopathies that lead to the Alzheimer's disease, and the other in the diabetes, they are playing a significant role. So what our lab is do, we are taking the phytoconstituents from the different source of the library, and then we perform the high throughput screening, then filter on the basis of drug likeness, and ultimately we get the compound which is supposed to be a lead molecule. Then of course experimentally we validate that whether the computationally predicted compounds would really having the desired benefits or not. So this is the whole protocol of our lab, and several kinase inhibitors have been discovered in our lab. I'm not going to talk about, just I'll show you the glimpse. These are the. Now I'm showing the results of one of my paper, that is work on the natural products called alpha mangosteen, and the alpha mangosteen, how the alpha mangosteen inhibits the kinase activity of MARC4 protein. So before going to that, we should know what is the MARC protein. So MARC4 is the one of the kinase, and that is the actually member of serine threonine kinases, and it phosphorylate microtubules, and controlling microtubule dynamics is essential for the cell division, and hyperphosphorylation, hyperactivity of MARC4 lead to the altered cell division, and that causes the cancer. So this is one of the well-known drug target for the cancer therapy. The other role of this protein is actually hyperphosphorylate tau protein also, and that hyperphosphorylation tau is causing neurodegenerative diseases, especially Alzheimer's disease. So we just make a rationale that if we will be able to modulate the activity of MARC4, then that of course controls the hyperphosphorylation of tau, and subsequently could be used for the drug development. So this protein has already been established as a drug target in the different diseases, and among them Alzheimer's disease is one of the disease. This is the expression profile of this protein. Just I am skipping this. Now you can see how this protein is modulating different types of diseases, cause it is like in the case of adipogenesis, it works through P38 MAPK and upregulation of JNK similarly. But if you see in the neurodegradation, it is actually hyperphosphorylating the tau protein, and in the tau there are in the tau there are several, you can see as the tau get hyperphosphorylated, they form the aggregate, and that aggregates are accumulated in the brain, and that lead to the Alzheimer's disease. So you can see there are several residue of the tau protein that got phosphorylated by the different enzymes, but MARC4 especially hyperphosphorylate is serine 262 residue, and that actually lead to the formation of tau aggregates. Structurally, this protein is divided into the three domains. One is the catalytic domain, one is the UBA domain, and other is the spacer domain. So catalytic and UBA domain both makes the protein fully active. So what we have done, we have taken the alpha mangosteen. Of course, this comes through the lot of several screening that I shown you. I've just skipped all these things. So from the natural product screening, we come to know that the alpha mangosteen is showing very good binding activity. Then we further analyze the data, and you can see here that it forms a lot of hydrogen bonded interaction with the active site pocket residue, and that showing that this compound is showing very good binding affinity. Now we subsequently check that whether this is the dynamically active or not, because we through the molecular dynamic simulation we can calculate that this complex is stable or not. So you can see during the course of simulation it maintains the structure, it maintains the bond, and everything has been maintained, and it's showing the a little structural changes occurs in the protein while binding to this one. It's showing that this ligand could be inhibiting appropriately to this enzyme. Now, of course, we must check the experimental that whether this protein, alpha mangosteen is able to inhibit experimentally or not. So we perform the kinase inhibition assay, and you can see here a dramatic increase in the kinase activity. The other thing we also checked that whether it is regulating hyperphosphorylation tau or not in the cell, and we perform the tau phosphorylation assay, and you can see here as we increase the concentration of alpha mangosteen, there is a dramatic increase in the hyperphosphorylated tau population. Then we check the binding affinity and the kinase activity. So you can see here a decrease in the kinase activity, as well as it is showing the very good binding affinity that was measured through the fluorescence binding measurements, and showing in the order of 10 to the power 7 per mole. Apart from that, of course, at the cellular level, we must check that whether this activity is good or not. So you can say in the MCF7 and HBG2 cell line, there is dramatic decrease in the cancer cells, and also we check that whether this compound is inducing apoptosis or not. So we check, you can see here in this panel, there is increase in the apoptotic cell population, and from the graph you can see a dramatic increase in the apoptotic population. It means that this compound is inhibiting cancer cell growth, as well as doing the as well as increases the apoptosis. After that, we check that at which stage of cell cycle it actually controls the growth, and you can see here that the most of the cells remain in the G2S phase, and it doesn't go beyond that, and that's what it controls the cell proliferation at the initial stage. Apart from that, it also showing the reduce in the ROS production, and it inhibited the metastasis. You can see here the foramen wound healing assay that we shown that if you treat the cells, there is migration is dramatically decreased. Now we come to the next. So, and in that pattern, several papers, several compounds have been identified and synthesized in my lab and have been published. So after that, since this project is related to the natural products derived from the Brahmi or the Bacopa moneri, so we have initial stage, we have analyzed all the literature and also some data sets, computational analysis we have performed, and we have classified on several different types of product present in the Brahmi. And now the next question, how this Brahmi fractions is actually modulating neuronal activity, and you can see here through the PI3K, AKT, GSK3 beta pathways, it controls the hyperphosphorylations. So the main rationale is that this plant product is known to modulate the kinase activity, and we have the kinase that is also involved in the Alzheimer. That's what we tried to check. We made the connection between the Bacopa moneri and the MARC4, and through that we just given the mechanism how it works, and after that we have taken the fractions. We have fractions of the Bacopa moneri extract, and then we performed fractionation by the chloroform, methanol, so several different types of the solvent, and performed the TLC. After that, the extract, ether extract was showing very good activity, and then further performed the flash chromatography separation through the ether extract. And after that, we perform the kinase inhibition assay to that fractions, and you can see here the dramatic decrease in the enzyme activity of this MARC4, and it is showing the IC50 value is much appreciable. Apart from that, we have checked the binding affinity through the fluorescence spectroscopy, and we get shown the excellent binding affinity as well. And this is the docking pattern, because we know that these are the major fractions of the Bacopa moneri extract, that is the bacoside A and bacoside B, and the docking score is showing very good. Apart from that, the residue which are forming the interaction, the residue of the pocket, active site pocket, forming very good interaction with the component. Now we have taken one fraction, one is bacoside 2, and again perform the docking to analyze the binding pattern, and you can see that it penetrates deeper inside the active site cavity and fits well to the active site cavity, showing very good interaction and very good binding affinity to with this. After that, we perform the MD simulation that whether this component will remain in the active site or not, because docking will give you some snapshots or some static picture. So we try to check the dynamics of this compound, and you can say this is the dynamically this compound is present in the active site cavity, doing the minimal structural changes as the good inhibitors do. After all, the hydrogen bonds that was maintained throughout the 100 nanosecond MD simulations, and you can see here the hydrogen bond pattern is maintained. It means this compound is interacted well to the active site cavity, especially the hydrogen bonded interactions. Then we perform the kinase inhibition assay, and now the IC50 value get much improved. Earlier case it was the 12, and now it is the 5.4 micromolar. Apart from that, we perform the binding affinity assay, and you can see there is a dramatic increase in the binding affinity as well. So this work is till now here. Of course we have planned so many things, but in a nutshell, the Bacopa moneri extract is known to modulate the neuroprotection, but through what mechanism we try to illustrate through this kinase inhibition, and targeting kinase via Bacopa moneri extract would be a very good connection between the Unani medicine and cutting edge computational science. That's all from my side. Thank you very much. At last, I would like to acknowledge funding agency. My lab is funded by all the funding agency, but especially CCRUM for this project. Thank you very much.
You have described two biomolecules. One is alpha-mangosteen and then bacopacide.
Yes.
Where from this alpha-mangosteen came? Is it extract of the bacopacide?
No. This is the different story. Just I would like to convey.
So you have combined a lot of studies.
Yes. No. Only the last.
We are doing the cancer research, or we are doing?
No. Just I would like to say that how the Ayurveda or Unani medicine, I am connecting with the modern science. For that, I have taken natural products. Yeah.
The study of Bacopa.
Yes. I have finished in limited time. Yes. Yeah. Yes. Sorry for the confusion. Yeah.
So much knowledge of the science.
Yes, yes.
Our science is limited to some extent.
Yes, yes. Sorry for that, but yes.
लेकिन आपने इतना कंफ्यूज कर दिया है कि मैं तो इतना परेशान हूँ कि मैजिस्ट्रेट कहाँ से आ
Okay, okay.
आना चाहिए था. Thank you very much.
Okay,
अच्छा
thank you.
पेपर है, अच्छा स्टडी है.
Yes.
This can be basis for the future studies also.
Yes. I mean, being a Unani person, you can suggest me that what else we can add or what else. What?
आगे के लिए जब भी ऐसे फॉर्म्स में आ जाओ जरा कंफ्यूजन क्रिएट करने की कोशिश करो.
ठीक है, thank you very much.
Next speaker is Dr. Farhan Garisa from Mother.
मैडम आप अभी कह रहे थे कि इनको जाना है शायद सो दैट वी कैन. अच्छा आप मुझे निकलना. ओके वी कैन.
How to change it from this side?
सर इसका इधर से बताओ. इसका उल्टा है ना, रिवर्स.
Next. अच्छा इस पे है ना, ठीक. Thank you.
बैक जाने के
Red one. Red one.
बैक रेड.
Big.
A very good afternoon to all the participants. First of all, I'm thankful to CCRM for inviting me this Unani Day. Although my topic of today's talk is more of theoretical and to educate maybe students about the importance of shelf life, which is very close to my heart because I'm working in this area, and shelf life of Unani medicine, or you can say shelf life of any product which we are using or we are promoting for human consumption. Because nothing is immortal, everything is going under degradation, undergoing change every day. So medicinal products are more important because we are prescribing those medicinal products for the treatment of a disease. So when we are formulating a product, we are formulating with a certain potency, with a certain dosage, and we have to follow a regimen. So when we are following those regimen, the potency has to be maintained throughout the life in which we are promoting it or keeping it on the shelf or given by a physician. In earlier times, when Hakim used to prepare their own preparation, they are mostly preparing those things fresh, or sometimes they are storing for a period of time. But they were very, very wise in using things like honey, sugar syrup, because they are natural preservatives. And honey is supposed to be one of the most stable products in the human history. If you see, if honey, I think we are just talking about the news, then in Egyptian pyramid, honey was found, and it was found to be in good condition. So they have used those formulations all over khamiras. They are very, very concentrated preparation in which bacteria or fungi are very difficult to survive. But now in today's era, when we are globalizing, when markets are opening up, we are marketing our product to all over the world. We have to generate data. We have to provide the product with good quality as well as stability. Because the product has to stay, if you are distributing throughout the world, it has to at least have a good life, so it can reach the consumer within its usage life. If usage life is short, you cannot distribute it all over the world. If usage life is only 6 months or 1 year, obviously by the time you are manufacturing it, marketing it, it is passing through several channels. When it is passing through several channels, when it is going to reach the consumer, it should have some shelf life, it should have some usage life. And as per modern medicine, usage life, as per our definition, it has to be at least 10% of the initial potency should degrade, and when 90% is remaining, then it is supposed to be good for usage. So only 10% of degradation is allowed in modern medicine. While in case of Unani medicine, we are dealing with various types of compound formulations. We are only one single component is not responsible for the activity or for the medicinal property. There are many, many components which are acting in tandem, in parallel, and they are having its therapeutic activity. Now, if you look at the global herbal market, it is increasing, especially after COVID. Everybody has realized, even the Western world has realized, and they are running after the herbal medicines, either it is Unani, Ayurveda, or Siddha. They are looking for a treatment they are looking for, because in future they are expecting more these types of outbreaks can happen, and we have to have something which can improve our immunity, which can improve our health. So stability studies, it can be defined as testing of those parameters or those attributes of the drug substances or compounds or drug substances which are susceptible to change during storage, maybe because of temperature, maybe because of complex formulation, maybe because of humidity, maybe because of light. So all these factors, they can catalyze the reaction which is going inside the any compound formulation. A compound formulation is comprising of various compounds. It can be alkaloids, it can be carbohydrate, it can be sugar, and everything is going under degradation with different rates. Sometimes some products, they degrade very fast, some products are degrading very slow. They follow different mechanisms. It can be oxidation, it can be hydrolysis, it can be reduction, and these things are happening. The job of a formulator is to minimize those rate of degradation and to produce a product which has minimum rate of degradation and which can last at least till the time it can be distributed and used by the consumer. So stability testing is important and performed for finding out the shelf life, optimal or storage condition, what is the best storage condition, and what is the retest period, and how the quality can reach the consumers. Now, when we are talking about product shelf life, as I have already explained, shelf life is the usage life. And storage condition is also very, very important. When we are talking about storage condition, we have different storage condition. It can be room temperature, it can be controlled room temperature, it can be ambient room temperature, it can be refrigerated, it can be under from 0 to 40 degrees centigrade, or it can be under freezing condition. So depending upon the properties of the compounds or properties of formulation, different storage condition can be prescribed or can be advised for the consumer or for the storage. Now in regulatory, as we all know, Drug and Cosmetic Act, a rule which is passed in 2005, and in that case, the date of expiry of Ayurveda and Siddha and Unani medicines, they shall be displayed on the label. So every manufacturer has to display the shelf life. And nowadays, consumers are also very, very sensitive. The moment they buy the product, they first look at the manufacturing date and expiry date. And now everybody is aware. Earlier, that awareness was not there. But now everybody is aware there has to be a manufacturing date, there has to be an expiry date, which has to be displayed. Now, in Unani literature, it has already been described that shelf life is the period within which the drug is able to keep its temperament, to keep its constituents, and its structural constitution in equilibrium, which may be judged by means of observing its organoleptic characteristic. Organoleptic characteristic means its color, its taste, its odor. If that is not changing, it means the formulation is stable. Earlier, our Hakims or Ways, they used to only look at the organoleptic characters. And I'm really surprised how wise they were, how they have intelligently they have formulated their products. What they are using honey, they are using sugar. And even today also, when we are testing these products, they are found to be stable for a period of at least 2 to 3 years. We have tested Unani products as well as other products which are available in the market, and most of them found to be quite stable if they are formulated as per the procedure which is exactly prescribed with the pharmacopoeia. So now, if you look at the literature, there are different references which I have found that depending upon the part of the plant, if they are flowers or leaves, they're supposed to be stable for about 6 months, depending upon how they are stored, because their stability is also depends upon the moisture content and the temperature at which it is stored. There can be fungal growth, there can be bacterial growth, which can decrease the shelf life. So when we are talking about shelf life, it is not only the temperature, but also the humidity which is important in which we are storing it and how we are storing it. Whether it is stored in jute bags or whether we are storing in sealed airtight containers away from sunlight. That is also very, very important, because if we are not storing it properly, no matter how stable your formulation, how stable your product is, it is bound to degrade. If you are storing in your sunlight, sunlight can increase the rate of degradation. If you are storing in damp condition, the moisture can be absorbed by the herbal products, either it is in the form of powder or in the form of leaves or root or bark. It is bound to absorb the moisture, and because it is from natural source, it has bacteria, it has fungi, and it will multiply and can eat out your complete product. Similarly, fruits are also supposed to be, it's not coming back. Fruits are also stable up to their respective seasons and even less because of the high water content. And then seeds, they are also depending upon the oil content. Oil can get oxidized. Where oil content is high, the stability shelf life can be up to 2-3 years. With more oil and fat content like tukhme khashkhash or tukhme tarboos, they remain stable for not more than a year. Similarly, kernels like akhrot, they have a shelf life of about 1 year, although if they are stored properly and their stability or their shelf life is higher. Extract is reported in the literature, their age is up to 2 years. But having said these things and going through these references, now what is required is to validate and generate data. Because modern regulatory bodies, if you are going to Europe, if you're going to USA, they demand data. So you have to generate data as per the modern guidelines. These are also some of the references where we have found out that herbs has a shelf life of 2 years, course or tablets is also 2 years, majun and so on. So it is ranging from 1 to 3 years. So now if you look at the main controversy which we are facing today, like in classical literature and the modern science, is basically generation of the data. And how we have to generate the data data generation has to be as per ICH. I think you are all aware what is ICH. It is International Conference on Harmonization, which is basically constituted to generate uniform guidelines. So that when we are marketing to different countries, we don't have to follow different guidelines. The guidelines has to be uniform. Even if you are performing the stability studies, if accelerated is 40 degrees centigrade, 75% RH, then it has to be the same in different regions. If it is different, it means the company has to generate different data. Earlier, what used to happen before ICH, China has a condition of about accelerated, they mentioned about 50 degrees centigrade. While US and UK, their accelerated is about 30 to 32 degrees centigrade. So because of this difference in condition, every company has to generate data on different condition, and that generation requires about 2 to 3 years. No accelerated situation was available, only real-time stability data used to be supplied to the regulatory bodies. And that creates a lot of problem in registering and marketing the product to different countries. So in order to harmonize those, ICH has come out with guidelines where you have divided the world into 4 quadrants. And these 4 quadrants have 4 sets of conditions in which we have to perform the shelf life studies. And if you are performing as per those ICH guidelines, your data is acceptable in all those countries. And you can market and regulate and register your product in those countries. These are the 4 climatic zones, temperate zones, Mediterranean, hot and dry, and very hot and moist. And these are the conditions where you have to maintain the condition of temperature and humidity, like 45% humidity for zone 1, 60% humidity for zone 2, 35% humidity for zone 3, 78% for humidity for zone 4. And these conditions are basically for performing accelerated stability studies. And accelerated stability studies is those in which you increase the temperature and humidity to increase the rate of degradation. And that study we have to perform for about a period of 6 months. And 6 months accelerated data is acceptable and can be submitted to regulatory body. And later on, you have to submit the real-time data, which can be 1 year, which can be 2 years, which can be 3 years. It depends for how long your product is stable. So this is how we have to perform these stability studies. We have to select our batches, and those batches has to be selected in different stages. First stage, when you are developing the product in the lab. So once your formulation is validated and stabilized, then you have to perform the stability studies on the lab batches. That data will guide you that whether your product is stable or not. Once you have validated the product, then you go to the production stage. And in production stage, for regulatory data, you have to perform 3 uniform batches of the product in production, and those 3 batches has to be put on stability as per your stability protocol. So first you will select the batches, then you will select the storage condition. What is the ideal storage condition for fiber product? If my manufacturing is saying that my product will be stored at 25 degrees centigrade temperature, plus minus 5 degrees centigrade, the accelerated will be 40 degrees centigrade. If I am saying that my product is stable under refrigerated condition at 4 degrees centigrade, and it should be stored at 4 degrees centigrade, then the accelerated will be 20 degrees centigrade, not 40 degrees centigrade. So depending upon your storage condition, you will decide about your parameters and your storage conditions. Then you have to select other attributes on which you want to test the product. Either it is organoleptic properties like color, shape, odor, or it has to be its chemical properties like SA or TLC or TLC markers, HPTLC, or it has to be content of preservative or content of other substances, moisture content, hardness, friability, all those things you have to mention in your protocol. And then you will have to define about the testing frequency. How fast you want to test it. Under accelerated condition, you have to test or sample the product every month. So every month you have to take out the sample and test it for its potency or whatever the parameter which you want to decide, whether it is hardness, whether it is moisture content, whether it is SA content, whether it's only TLC. So all those parameters you have to decide. And then frequency, whether once a month, twice a month, or maybe only after 1 year, 2 year, 3 year, and so on. Then you have to also decide about what is going to be your storage container. A storage container also plays a very, very important role. If your container is not proper, then your stability is going to be affected. Sometimes when we are talking about complex formulations, they do react with the container. If your container is only metal container, then it will react with your various types of tannins, various types of alkalides. So you have to have a container which should not interact with the product. You have to have a container which should retain the potency of the product, which should not allow oxygen and moisture to enter, and should maintain the integrity of the product. So with these guidelines and conditions, you can definitely perform the shelf life of your product. Whatever product you are developing, you should think about what should be the storage condition, what should be the parameters which can define the quality, what should be the final container, and how I'm going to market this product. So those things, if decided, then your product will be stable for a long period of life. Thank you so much.
Thank you, sir, for your informative presentation and taking some time out from your busy schedule. As Dr. Farhan Alis is engaged in another conference, so with the permission of chairs, may I request Professor Dr. Kumud Bala ma'am to present a memento as a token of gratitude to Professor Farhan Alis, sir.
I'm sorry, ma'am.
Department of Ocular Biochemistry, AIMS, New Delhi. Her topic of talk is Unani medicine, ophthalmology, a scientific approach.
Good evening, everybody. And with the permission of chair, I will want to wish to talk about Unani medicine in ophthalmology. As we know that Unani medicines are having great potential in prevention and management, both for life-cycle disorders, acute and chronic diseases. And today we know that the traditional medicine is gaining a major concern because not because they are more effective, they are not less effective as compared to allopathy, but they are having less side effects and they are cost-effective and easily available. But the thing is that we need a scientific parameter or a scientific acceptance from the global side. So for that we have to produce data, as our previous speaker has spoken, because we have to authenticate our results. We know clinically that Unani medicines are very effective, but we have to give the scientific parameters to the world for that it should be globally accepted. And for that we know that they are clinically accepted. So what we have to do is we have to do the reverse pharmacology. The thing is, it is clinically known that it is accepted, but at the lab side we have to produce the data to support our clinical data. And reverse pharmacology, as we know, is less time consuming, because to produce a conventional drug takes many years. But if we consider on the lab side, it is 1 to 2 years job to produce the lab data, investigative lab data for the clinical Unani or any other medicines, to produce that this is the subject parameters that support the clinical results. So for that, if we say that the thing is, the drug should be properly standardized. After standardization, the purity, then it should be biological assay that should be taken to see that the pharmacological actions and the mechanism of action of these drugs can be easily explained to the world. We know that in the patient it is working, but how to explain that what is the mechanism in the body or in the human cells these drugs are doing it? That should be very clear in our mind. Then if it is clear in our mind, we need explain to the global side or the other side of the world. They know clinically it is accepted, it is clinically well proven, but we have to produce the data. And in some studies, we need the animal studies. And in clinical trials, as we know, that we have to introduce both subjective as well as objective parameters. Subjective parameters are variable because it depends upon the patient and the clinician who assess them. The patient can say that we are getting less pain. Another patient for the same grade can say, no, the moderate pain is there. And the two clinicians also have variable in their assessment. So those subjective parameters has to be supported by the objective parameters. We should have some lab investigations or some investigations or the mechanisms to support our subjective parameters. So if we say that the Unani medicines have potent pharmacological activities, we know that they have anti-inflammatory, antibacterial. We see many times that this drug is having, they are very good immunomodulators. But what about the data? If we see that, yes, some patient has come with some illness and some antibacterial activity and that has been cured, but how? How much we have that this drug is having potency to as an anti-inflammatory activity? How much is antibacterial activity in this drug? We should be able to answer to the world. We know that we have power, we have reach in this pressure, but how to prove this? So we should know the things. Like suppose we say anti-inflammatory. So we should know that how this drug is affecting interleukins levels, cytokines levels. So all these parameters we should know. So we should get tested all these parameters in the patient and say, yes, this patient is effective. It has been cured by 1 week, 10 days, 15 days. But with these parameters, the 0-day reading is this, and after the treatment within the intermediate, this is the readings. If we say it is antioxidants, then we should produce by biological assays like superoxidized ROCs levels. So I'm just telling about the basic things. Like I'm not going to detail how to do it and how it is done, but what parameters to be done. So if we say it is an antioxidant activity, but we should produce it, the data also. So what are the clinically produced? All your clinicians in the Unani medicines, you are doing to the patients, giving the treatment to the patients. You say that these Unani medicines are very effective, but where is the data? So you should have at the 0-day levels also what is the parameters, and at the end of the treatment or in intermediate also, if you want, you should have the parameters to show the world that yes, this is the results, we are producing it. And if we say as ophthalmology, if we say that Unani medicines, from the literature I have come to know that many Unani medicines are being used for glaucoma, for diabetic retinopathy and for AMD. Now we know because diabetes is increasing very fast, the incidence of diabetic retinopathy is increasing very fast. Most of the patients, diabetic patients, with less span of time is getting diabetic retinopathy. So, and glaucoma also. So the major concern in the ophthalmology is there that where there is nothing to offer to the patient, like RP, retinopigmentosa, there is nothing to offer from the allopathy side, and it's a degenerative disease. And many of us were claiming that we have many Unani medicines that manage the degenerative diseases. They have the anti-degenerative properties. So why not test this? And this the patients, we get the ethical clearance very fast because there is nothing to offer to the patient from the allopathy side. So the ethical clearance is given to this for the clinical trials also. And for developing drugs to the glaucoma patients also, because glaucoma, because of stress, because of many other reasons, it's increasing very fast in our system, in our day-to-day life. As glaucoma we say, or kala motia, is a silent killer of vision. We don't know even when we are sitting that we are having glaucoma, and it progresses very slowly, but progression and its irreversible damages to the optic nerve. So that the glaucoma is getting main concern because most of the population, the incidence is increasing very fast. There are two types. One is open angle, one is closer. Closer means I'm not going to go into detail how it's acting, but closure means the angle, the anatomy of the eye has been changed, so there is a stoppage. It has to be either surgically treated or it should be laser done. But for open angle, we have lot of options. For open angle, we are giving the treatment, but some allopathy medicines, when they give the treatment, even the drops, they have the side effects on the cardiocytes and other sides. But if we have a Unani medicine that can decrease the IOP, but how to prove it? They are saying that many medicines clinically tried for glaucoma, but how to prove it? How to say yes, they are working? So we just think that pathomechanisms are there, like it is oxidative stress that causes the glaucoma, aging, autoimmunity, and many more factors. But now the concern is how to prove that this clinical Unani drug is very effective in glaucoma. So we should know that there are two sites which are affected in glaucoma. One is RG, retinal ganglion cells, the damage to the optic nerve it causes, and trabecular meshwork cells. These two sites are affected in glaucoma, and they are irreversible as per the allopathy side. So the oxidative stress causes damage to the trabecular meshwork as well as RG cells. So RG cells have an optic nerve damage. Neuro disorder is there, nerve disorder is there, degeneration is there. So if any drug which has antioxidant property and a neuroprotective can be useful for glaucoma, that was our idea. So we thought, like, if they are claiming, yes, this is the glaucoma, a very good formulation or very good drug for glaucoma, why not try and give a clinical or experimental data to this clinical drug? Keeping in this mind, we got a Unani drug formulation from CCUM, so which is claimed to have neuroprotective and as well as antioxidant property from the literature. This is from the literature, we said. But now we have to prove. So proving means we have to see this effect on two major sites which are affected in glaucoma. So the two major sites are trabecular meshwork, I said, and retinal ganglion cells. Trabecular meshwork cells we can get directly from the patients, but there is, and so that mimics or that is equivalent to glaucoma cells in the patient. Directly from the glaucoma patients we can get trabecular meshwork, and we can try our drug, the effect of our drug on this trabecular meshwork in vitro studies, the biological assays. But there is a limitation for retinal ganglion cells, because ethically we cannot remove retinal ganglion cells from any patient. So what? Because there are two sites, we have to see two sites, what are the effect on two sites if any glaucoma drug has to be claimed. So what we have produced one in vitro model, we have taken the RG cells from the cadavers, from the donors. So, and given a high pressure, because IOP is high in glaucoma, and produce the same environment in these RG cells. So this is the, to our best of our knowledge, this is the first model which we have developed for glaucoma mimicking models, that is one trabecular meshwork and for this high pressure RG cells. In two sites, if we see that the effect of any drug, then we can say scientifically, yes, these drugs are effective. Though they are clinically claimed that this is effective in glaucoma, but how to prove it? Now the thing is we have taken this drug and seen the antioxidant properties like DPPH. We found that this drug is having antioxidant property. This result has been supported by nitric oxide inhibition assay, and again we found that this drug is having antioxidant property. We have seen the flavonoid content also of this drug and seen that this drug has a flavonoid content. Similarly, we have seen the phenolic content also, and we got that there is a phenolic content, good quantity in this drug. So now we can see that this drug, what we has been given, has the antioxidant property. So how to prove that this works on the trabecular meshwork, because it should give improvement or it should affect the trabecular meshwork. Now the question arises, like, it has antioxidant properties, but a drug should have neuroprotective content also. But the world will say, what are the components, what are the constitutions? So we should know the constitution of what is the things. So we have gone to the LCMS and we have done LCMS to see the active compounds. So through the active compounds, we have come to know that this is the compound which we have got in our drug, and from literature it is well known these are neuroprotective in nature. So So these compounds are found in our drug. It means the drug which they are claiming should have the neuroprotection. And another one is the downstream, it has antioxidant component also too. So these drugs have active compounds which are having the antioxidant properties. So whatever is being claimed that this formulation should have antioxidant properties as well as neuroprotective. So this data is showing yes, this drug will have the antioxidant and neuroprotective activities. Now the next step, like in the patient sample we have to see. So before proceeding to the sample directly giving to the patient, we should show the in vitro studies. So what we have done is, as I said before, we have taken the typical meshwork, we have cultured them out from the patient, and now we are seeing this formulation, aqueous content of this formulation on the antioxidant properties, seeing the biological SOD levels, dismutase levels, other biological activities, flow cytometry assays to see that they have the antioxidant properties. And for the neuroprotection, we are using the neuroprotective markers. So if this drug's having a neuroprotective marker, it should enhance the neuroprotection. So at least if we can have a drug which can at least slow down the progress of glaucoma and can control, because if these two activities are there, then RG cells will have a neuroprotection and antioxidant properties will save our tabular meshwork site. If these two sites are saved, then we can say yes, these drugs can be used. And in vitro studies will also give us has given us the toxicity levels also, safety levels also, like LD50, how much we should use it. So this isn't just example, I'm saying this type of studies we are conducting in our lab in collaboration with CCUM to see that what is already proven drugs in the ophthalmology. So that can give, because in glaucoma, as you know, it's a hereditary. We can only give patients who are affected the drugs, the allopathy drugs. But what about the relatives which are at high risk of developing glaucoma? But ethically, we cannot give them the drug. But if we can give our Unani medicines a prevention also to those patients.
Please show some respect to the speaker. If you want to talk, go outside the auditorium and talk. You're disturbing the whole auditorium.
Okay. So if this type of things we have to do it, we can do it, and like we can produce that any drug which should be given to the scientific world, we should be able to explain them how they are acting, what is the mechanism of action, what will be their LD50, what will be the toxicity levels, and if they are clinically proven, we can do the reverse pharmacology. So I think from the morning the forum is saying we have many Unani drugs for many diseases. Yes, we have it, but we should do the reverse pharmacology to prove them and give the data to the things. This is just an example I'm saying. Even I should like to mention that we are doing one more trial. We are using one formulation for immunomodulator and anti-aging with the geriatric medicine in AIMS. And in that, what we have done, because we don't get the ethical clearance for the patient, to be very frank, if we not give the data, they were not going to give us the ethical clearance for the patient. But in that project, what we have done is, we have written that formulation and we are doing it in our lab, all this type of test in the geriatric medicine from the patient. And first 2 years, we are producing the data. Like it is safety data, is standardization. We have get the standardization of the formulation from the CSIR lab. So we got all the authentication of all the individual ingredients and we got the certificate from them. Yes, they have how purity it is. So make the formulation. And then we have given to the biological assays. And after biological assay, 3rd year we'll be doing the clinical trial. So we got the clinical trial subjected to what we'll get in the first 2 years, the results. So in the same project, we have got the clinical trial, but provided we are doing in our own lab with all the parameters to explain to the ethical. So the drug is again already been clinically trialed, as Unani people said, they are clinically tried in their clinical practice. But they are given that drug to prove us to in the thing in AIMS so that we can produce the data. So I think the Unani medicine has great potential, no doubt, and it should be explored like anything, but it should be, as everybody is saying, it should be a joint hand and in collaboration, it should be done and with the more scientific parameters so that it can be produced. Thank you.
Formulation का जिक्र
Sir, it is coded drug from CCUM, so it's the ongoing work.
So it is a coded drug.
Yeah, it's the coded from the CCUM. So I think I should thank at least the CCUM and the Ministry of Ayush for giving the opportunity. Yeah, it's having the salt and soft and everything, but the constitutes and everything is.
No, naturally you have to keep it because
Yeah.
getting it. But we have in tradition, because you have mentioned that berberine is in it. हमारे पास tradition एक है कि जो रसूल है, Racina berberis lycium, हमारे pharmacopoeia से उसको traditionally लगाया जाता है in bliphides, in conjunctivitis.
Use क्या?
रसूल हमारे पास जो हो, that is the resin of this berberis lycium. अभी आपने इसमें लिखा था कि इसमें berberine भी है, आपकी formulation है, उसमें berberine भी आता है, that is from the berberis lycium. Okay, whatever it is, but this is the open field. Ophthalmology is yet an open field for the research. No?
Yes.
There has not been done so much research in case of Ayush is concerned, as far as Ayush is concerned.
What's that?
As far as Ayush is concerned, ophthalmology is yet an open field.
Yes, sir. Yes.
Very less research in this.
Yeah, sir, we feel that lot of potential is there, no doubt. Everybody is saying, but the thing is, ki if we put it with the open mind, not with the thing that efficacy is less or more, with the open mind, if we give to the world the parameters, like even in allopathy, many drugs, even in the after the animal trials, you know, the leukoderma and everything, ICMR, it has gone to the third trial. After that, it's failed. They have not come to the market because, and Dr. Maya's 40 years research has gone into that. Because the thing is, ki once you try it, and you have to be open, and you have to give the scientific data to the public, to the globally acceptance.
You are doing preclinical of this drug also, or you are doing only clinical?
Sir, we are doing combined.
Preclinical as well as clinical.
We are preclinical as well, because the preclinical data, otherwise we have to get it authentically from CCUM or any other agency, then our ethical committee give the clearance. Otherwise, we are producing, in these two projects, we are producing the preclinical data, and then we had taken the ethical clearance. And preclinical data also, like if we are giving authentication, then we are doing from the CSA lab or from the government labs, and then we are producing the number with the number to our ethical clearance. But on the pilot study, we are doing only the small sample size. Okay, thanks. Thanks.
The next speaker is Professor Unani sir, from Department of Biotechnology, Jamia Hamdard.
Should I start? So, good afternoon to all of you, the dignitaries on the dais and the audience. I am very much thankful to CCRM for providing this platform to me on the occasion of Unani Day. So it's international conference. Now, actually, I am going to speak on the work which I did with the support from CCRM and Department of Ayush Government of India. We did work on the quality control aspect. Actually, I think, please move the slide. So, अच्छा, ये यहाँ से अच्छा, green. Okay, thank you. So we already know that in Unani drugs, we use like raw herbs, their parts in formulation, or even actually we make syrup and also paste using those parts of the herbs. And we also know that the efficacy of the drug basically depend on this one. So efficacy of the drug is basically dependent first on the genuine herb. So we have to use genuine herb in making formulation. Then comes like the parts. So parts from that herb is to be taken. Even before that, if we want to maintain the quality of the drug, it starts even from collecting the sample, collecting the drug or herb from the area where it grows in the correct season. Also, the time when we should collect. So all these actually influence the quality of the formulation that is being prepared from these herbs. And actually, initially it was not known to the Unani practitioners that there are certain bioactive molecules which impart them the therapeutic efficacy. But of course, with the advancement of the chemistry and the analysis of the drugs later on, we came to know that there are many bioactive compounds which are present in these herbs, and their therapeutic efficacy is because of the presence of those active compounds. So if we are not using the genuine herb, definitely we are going to compromise with the quality of our formulation, and we are also then compromising the therapeutic efficacy of the formulation. Now, how we are going to identify the genuine herb? Actually, this is a question mark, though in traditional pharmacognostical method, there are many many parameters which have been mentioned, and they are part of our pharmacopoeia. So they are being used to identify the herbs which which come to the Unani pharmacy to prepare the formulation. But as we already know that these are depend on either morphological features, anatomical features, organoleptic characters, and then of course sometimes actually analysis is also being done now, the compounds which are there present in the herb. But it happens that actually there are variations not only in in morphological features, also anatomical features, and then many other characters. Actually, if you take a plant species, there are many varieties of that species, and also then there are different after varieties we have isolates, different isolates, ecotypes. So what happens actually in Unani, when I interacted with my Unani friends, physicians, they have said, for example, in case of asagandh, Withania somnifera, if you use Withania somnifera from Nagaur, which is one of the geographical region in our country, so that is more effective than the asagandh from other parts of the country. Similarly, we have been told that if we use this senna from Tamil Nadu or from Rajasthan, the property may vary. So basically that suggests that there are variations in the phytochemical constituents of these herbs depending on the climatic conditions of that particular region that influence climatic conditions, and also the edific factors, soil factors, because soil is not only providing nutrient, but it has also microflora and fauna that interact with the herb and then actually influence the its phytochemical constituents. So actually how we can identify the genuine herb which is to be used in making Unani formulation. We already know that in genome of every species, there are certain sequences which are unique sequences to those species. So if we identify those unique sequences for the herbs which are already established, which are genuine. Then using those markers at the early stage, we can identify the genuine herb. So actually, as we already know that in case of medicinal plants, many the genome sequence of the medicinal plant is not known. So we don't know the unique sequences which are present in the genome of these medicinal plants. So when I was part of pharmacopoeial committee of Unani medicine, so at that time actually the chairman was a pharmacognostic ये जो ये उसके जम्मू में जो है वो थे डॉक्टर नहीं बिफोर लॉन्ग बैक विश्वकर्मा साल नहीं वो भी नहीं थे वो अभी जो he was chairman at that time anyway, so he was chairman at that time. So he told me that how will you be able, since the genome of these herbal medicines are not known, how will you be able to generate these unique sequences? So I told, because at that time literature was present, I told him that we have certain sequences like RAPD, RAPD primers. So we have RAPD primers, and we can generate those amplicons, and from those amplicons we can identify the unique amplicons for a given plant species, or the variety, or the even sub-variety. So we can do that, and after developing those amplicons and identifying unique amplicons, we can develop SCAR primers. And using those primers, we can generate the SCAR markers for those herbs. So actually, these are the steps that are involved in in SCAR marker development. First, we have to isolate the DNA from the herb. Then we have to, after this DNA, then we have to use RAPD primers, and then amplify this DNA. After that, then we can identify the unique amplicons from the genuine herb, and even for adulterants, which are already mentioned in Unani literature, are there are information available. So many of the Unani the herbs which are used in Unani medicine, they also have this adulterants, and they are basically mixed with genuine herbs. So we can develop amplicons for those, and those unique amplicons then cloned in a suitable vector, put into E. coli, and then we can after that we can sequence those amplicons. Then we make primers, and after primers, then we can further amplify the genome of the genuine herb and the adulterant, and we can generate a unique fragment that is SCAR marker, unique DNA fragment. So this is the whole procedure which is being carried out. And actually, if you see here, you can find that there are different Unani herbs which are used in mono-herbal formulations. So, for example, like Barge Sudab, its leaf of Ruta graveolens. But actually, we have seen through our research, what we found that majority of the market samples, they are completely replaced by the plant, this Euphorbia drunkenculoides. Like the herb which is marketed in the name of Burgess Sudab, it is not ruta graveolens but Euphorbia drunkencolloides. And then there are also different kinds of adulterants which I have mentioned in this slide. You can see here like there are many adulterants which are being either mixed or like replace the genuine herb, and they are being marketed. So actually I have just given an example here how we can use our scar marker which we generated to identify the market sample whether it is like genuine or the adulterated one. And even the formulation which is marketed, we can also isolate DNA from that, and then we can through our scar marker we can say whether this formulation is genuine or the adulterated. So the example here I have given is Tukhme Kasus. So we already know that seeds of this plant, Cuscuta reflexa, there are two species of Cuscuta. One is Cuscuta this reflexa, and the other one is chinensis. So this Cuscuta reflexa seed is Tukhme Kasus, and if you see the seeds from these two plants, they are very similar morphologically. If you go to market, you procure the seeds of this Tukhme Kasus, you will find that it's Cuscuta chinensis seed. It is similar to this Cuscuta reflexa. So if the formulation, any Unani formulation which is made from seed of Cuscuta chinensis, definitely that is not going to be effective in treating the disease for which it is meant. And even in powdered form, I have shown, in powdered form you cannot distinguish it. So what we did actually through our technology that we have developed for scar marker, you can see like in the slide, as I have told that first we use RAPD primer after DNA extraction. DNA extraction is also a problem from the medicinal plant because they have they are having lot of phenolics, alkaloids, and many other chemical constituents. So that is one of the problem to get intact DNA molecule. So we have already developed a methodology in our lab by which we can extract pure DNA from the material, and that is two which can be amplified. So through this RAPD primer, we have amplified the genome of Cuscuta reflexa and also Cuscuta chinensis, and we found like some unique bands amplicons from our study. So actually if we see here like in Cuscuta reflexa we have found an unique amplicon of 690 base pair, and Cuscuta chinensis 576 base pair. So we make then after sequencing these fragments, then we make internal primers which were scar primers, and then we did we use these primers to amplify the genomes from Cuscuta reflexa and Cuscuta chinensis. And what we found is that these these primers were highly specific. They can only anneal with the in the genome where they have this homologous sequence. So they anneal there, and then they, that particular region is amplified. So if we use scar primer from Cuscuta reflexa, it will not be able to amplify the genome from Cuscuta chinensis, and vice versa. And actually then we mix these two samples together, isolated DNA, and then what we found is that when we use scar primer from Cuscuta reflexa and then amplified the genome which we isolated. So it was mixed genome coming from Cuscuta reflexa and Cuscuta chinensis. And then if we use Cuscuta reflexa primer, naturally depending on the quantity of the powder from these two species and the DNA quantity, actually we got differences in the not in the size but the intensity of the fragment which we measured. We also measured it through spectrophotometry, and actually in that what we did, we have taken after amplification, we taken the mixture. So naturally these DNA fragments were present, and accordingly we have been able to throw this taking OD at 260 nanometer and 280 nanometer, we have been able to work out the concentration of what is the concentration of the these two seeds, powder present, mixed. So we have published it, and then actually there is also polyherbal Unani formulation, and as we have already expertise in making scar markers for monoherbal formulations, we have also extended this work for making scar markers for polyherbal Unani formulation. And actually one of the challenges again was that when we have polyherbal Unani formulation, naturally many herbs, they are mixed together. So we have a mixture of DNA population when we isolate. So how to amplify each of the component and develop a scar marker for them, that was a challenge. So we did, and in one of the Unani formulation, it was Jawarish Kamuni. From this formulation, we isolated DNA species, and then we again did the same, follow the same protocol. We developed scar. First, we did RAPD, get unique amplicons for each of the component of this Jawarish Kamuni, and then we again develop scar markers for them. And actually we have been able, you can see here in this slide, you can see here we have a market sample of Jawarish Kamuni, and you can find that one of the component which was missing in this was this Bargesuda, Ruta graveolens, that was not present. Instead, we have found this, previous कैसे आएगा इसमें? हाँ, yeah. So if you see the DNA fragments in the slide, you will find that the DNA fragment of Ruta graveolens was missing. Whereas Euphorbia drunkardis, that was the adulterant, its DNA fragment was present on the right side, if you see. It was present. So it means that in Jawarish Kamuni, Ruta graveolens was not present. Similarly, Keram carvi is another component of this Jawarish Kamuni. So what we found that instead of Keram carvi, Cuminum cyminium was present in this in this drug which we got from the market. In other cases, we even Piper nigrum, Filfilacea, that was basically adulterated with Quercus papaya seeds, So they actually, on the basis of these scar markers, we can control the quality of the Unani formulation. Actually, we can check the herbs when they come to the pharmacy for making Unani formulation. And we can also, like if the formulation comes in the market, we can again check that, whether they are genuine or not. Now, actually, we in case of Unani mono herbal formulations, you can see here, like we have done, we have taken market samples, and though our sample size was not very high, but of course 12 samples we have collected for each hub. And if you see, like in case of Tukhme Kasus, the genuine sample was only 33%, while adulterated was 66%. In case of Barge Sudab, actually it was completely replaced by euphorbia drunkenploids, so it's all substituted. And then in other cases also you can find, like we could get adulterated samples and also like the samples which were genuine from the market. We actually got these samples from South India and also from North Indian market. So in the conclusion, definitely I would like to conclude that actually these scar markers are very important tools to assess the quality of the herbs that are used to prepare Unani formulation, so as to maintain their therapeutic efficacy. And that is very important for Unani physician to work with these drugs. And actually these are the patents which we generated through this research. So we have 9 patents. And then these are the research papers which we published in different journals from this work. Actually, I would like to thank my students who did work in this area, and also I would like to thank CCRM and Ayush for giving us funding to do this research. For infrastructure, we receive funds from UGC SAP and DSTFIS, so they are also, we are thankful to them. So thank you all, and if any question is there, I am ready to answer.
Wonderful, sir. Sir, I have one query.
Yes, please.
Are these scar markers available in public domain?
Actually, we have patented for these. Actually, because these are the unique amplicons we have identified from the medicinal plants. They are very unique. Okay. So we patented them. So though they are not in public domain, we shared with your sponsoring agency? Yes, actually these are patented by the CCRM itself. Okay. So CCRM and Jamia Hamdard together patented these.
We were having this problem basically, that we cannot, if you have leaf 52, there are 52 herbs, how can you generate data of each herb and say that no, this leaf 52 is original and this is duplicate? That was the problem, and this problem has been solved. But one thing I will tell you, as you mentioned, that Asgand of Nagur, and whenever Asgand comes in the United States, it is Asgand Naguri.
In text, it is there.
Whenever Raven comes into the United States, it is Raven Chini.
सर लेकिन सर जो है, अब आप देखिए जो असगंध है, we are now cultivating in different parts of our country, and the thing is that the climatic condition and edific factors which are there in that area, those will not be in like Uttarakhand or in Bengal or in other part of the country.
In hilly regions, those plants grow in stress, so they will be having more bioceuticals as compared to the plants produced in the plains. And now we have
that's not always, sir. I am telling you, actually stress is definitely, stress is an stimulant that actually modulate the secondary plant metabolism. But it is not always that the kind of compounds which are needed for the therapeutic efficacy of a particular drug, they are always like will be highest when they will be grown in hilly regions. It is not always there. Because actually microflora and fauna which are there in the soil and the like nutrient status of the soil, they influence that.
Number two, we have one chapter on
Yes.
Abdal Adviya,
Mhm.
that you can substitute this medicine with this medicine, this herb with this herb. And we have total one chapter, madam is there, we have total one chapter on this. Abdal Adviya is one subject in Unani.
Sir, I am telling you, euphorbia drunken chloridas, it has many poisonous substances. And ruta
It
graveolens,
is not necessary that will be.
ruta graveolens is an aromatic plant.
It is not necessary that.
So
instead of this-
euphorbia drunkencollidas, which is there in the market, how can it replace this? Of course, I know that. For example, like Socia chiraita, you have replaced it by Andrographis paniculata. Calmeg,
Iris
that is accepted.
repellences. There are a lot of things.
So
which are-
many, I know, because actually I have
Another thing
interacted
is
with
availability.
most of my Unani physicians.
Availability of a herb in the region.
Yeah.
You see now lavandula has been grown in Kashmir, but we
Yeah.
are not having lavandula there. Instead of lavandula, we are using prenula. And when tested in the laboratory, both have same phytosticals. So this was the knowledge of those who came, their usage of brain, that they mentioned that no, in this area you can use this herb instead of that herb because that herb is not grown. So these things are there. But
of course,
whatever you suggested, this SARS mark, this is the game changer. This is the game
सर
changer.
एक चीज़ और मैं बता रहा हूँ, मैं बता रहा हूँ, देखिए अमी मैजस है, ठीक है, इट्स इजिप्शियन प्लांट, इजिप्शियन, we know already native to Egypt, but like when there were exchange, like physicians from our country, they were going there, from there they, so like this ami मैजस, it came from Egypt. It was cultivated here, adopted the conditions of India. So now we are using this Atrilal in Ayurvedic medicine, in Unani medicine.
I had first discussion with you in 2011, sir, when we were trying to go for genetic this predisposition of temperament. You might want.
Yes.
तो हमने
Actually
discussion किया है।
हम लोगों ने डिस्कशन भी किया था एंड वो बाद में जो है अल्टीमेटली पुणे में जो है वो प्रोजेक्ट गया
लेकिन
और
वो फेलियर हुआ
जी
कि जिसने इसका आइडिया दिया था उसको दिया नहीं गया।
वो दिया नहीं
जिसका
गया
idea
वो
होता
गया
है,
और
उसको
और
पता
मैं
नहीं
ये
कैसे
बताऊं
होता है।
और
वो किसी दूसरे को दिया गया।
वो टेम्परामेंट का प्रोजेक्ट जो है वो सक्सेसफुल भी नहीं हुआ, ये भी बता रहा हूँ, हमारी यूनिवर्सिटी में भी एक साहब को दिया गया था, सो इट वाज नॉट सक्सेसफुल एनीवे। थैंक यू वेरी मच।
So I would like to conclude this session with Professor Rafi's speech. And the journey of the session was quite amazing. It started from the neurodegenerative diseases and went to self-life of an Unani drug, and later we concluded the session with the scar markers and drug authentication. It was quite informative. And I hope you all will enjoy
पहले
it.
इम्तियाज साहब फिर जसबीर को फिर इजहारुद्दीन साहब फिर उसके बाद तब चेयर
Thank you, ma'am. On that note, I request, it is time to present the memento as a token of gratitude to our honorable speakers. I request Dr. Kumud Bala ma'am to present a token of gratitude to Muhammad Imtiaz Hassan Sahab. I now request Professor Muhammad Mehfuzul Haq Sahab to present a memento to our next speaker, Dr. Jaspreet Kaur. Thank you, ma'am. Now I request Dr. Yunus Munshi Saab to present a token of gratitude to Professor Zainul Abdi Saab. Thank you. Now it's time to thank our chairs. I request Dr. Munshi Saab to present a memento to Dr. Kumud Bala ma'am. I again request you, sir, to present a token of gratitude to our chair, Professor Mohammad Mehfuzul Haq Saab. Now I request Professor Kumud Bala ma'am to present a memento to Professor Yunus Munshi Saab. Thank you, chairs. It's an honor to have you all here as chair. And I would like to thank all delegates who are present here and those who are joined us today through online mode. Thank you once again.
नीचे आइए